The trauma bay doors exploded open at Ridgewood Memorial Hospital in Silver Ridge, Colorado, and the arrogant surgeon who'd spent months humiliating quiet nurse Sarah Bennett was about to discover exactly who he'd been tormenting. When the military helicopter landed through the storm and armed soldiers carried in a dying operative, everyone froze, except Sarah. She moved like a weapon. The limp vanished. Her hands became precise instruments of war. And when the patient's violent thrashing nearly killed the medical team, Sarah spoke one word that made a decorated combat soldier go completely still. Dr. Marcus Hale had called her worthless that morning. By midnight, he'd be watching military officers salute the woman he'd treated like garbage, while his entire career collapsed around him. Before we dive into this story, I want to invite you to stick with me until the very end, because what happens next will leave you speechless. If you enjoy this story, hit that like button and drop a comment telling me what city you're watching from so I can see just how far this story travels. Now, let's begin. The fluorescent lights in Ridgewood Memorial's emergency department buzzed with that particular frequency that made Sarah Bennett's head ache after 12-hour shifts. She stood at the supply station, methodically checking IV kits with movements so precise they looked rehearsed. Her dark hair was pulled back tight. Her scrubs hung loose on a frame that seemed smaller than it should be. When she walked, there was a hitch in her left leg, subtle enough that most people didn't notice until they'd worked with her for weeks. "Bennett, are you seriously counting gauze pads again?" The voice cut through the ambient noise of monitors and murmured conversations. Dr. Marcus Hale stood 15 feet away, white coat crisp, dark hair swept back in that way that probably looked good in hospital promotional materials. He had the kind of face that belonged on billboards, strong jaw, confident eyes, the sort of appearance that made hospital administrators excited about recruiting videos. Sarah didn't look up. Protocol says you do what I tell you to do." Marcus moved closer, and 3 residents trailing behind him slowed their pace to watch. "We've got actual patients who need care. Maybe focus on that instead of playing inventory manager." One of the residents, a young man named Jason with expensive sneakers visible beneath his scrubs, snorted. Another, a woman fresh out of nursing school named Melissa, exchanged glances with her colleague. Sarah's hands didn't stop moving. She finished her count, made a note on her tablet, and turned to face Marcus with an expression that gave away nothing. "The trauma kit was missing supplies yesterday. I'm making sure it doesn't happen again." "Yesterday's problem is yesterday's problem." Marcus gestured broadly at the emergency department. "We've got 3 incoming MVAs, a suspected stroke, and a kid with breathing issues, but sure, count your bandages, really making a difference." The residents laughed, that particular kind of laughter that comes from people trying to align themselves with power. Sarah had heard it before. Different hospital, different city, different circumstances. The sound never changed. She moved past Marcus without responding, her limp slightly more pronounced when she was tired. Behind her, she heard Melissa whisper something to Jason, followed by more muted laughter. The ER had been like this for 8 months. Sarah had arrived at Ridgewood Memorial with minimal fanfare, just another transfer nurse with solid references and a quiet demeanor. She worked night shifts mostly, took on the cases other nurses found tedious, never complained about assignments. To the younger staff, she seemed almost invisible. To Marcus Hale, she was a convenient target. "Bennett," Marcus's voice carried across the department an hour later. "Room 4 needs a catheter. Think you can handle that without supervision?" Sarah was already halfway to room 4. "On it. And try not to take all night. Some of us have actual medical decisions to make." The patient in room 4 was an elderly man with kind eyes and hands that trembled. Sarah worked quickly but gently, explaining each step, keeping her voice low and steady. The man thanked her 3 times. She smiled, a real smile, not the careful neutral expression she wore around Marcus, and made sure he was comfortable before updating his chart. When she emerged, Marcus was holding court near the central station, surrounded by residents and a medical student who looked about 19. He was explaining a complex cardiac case with the kind of theatrical flair that made everything sound like a performance. "The key is recognizing the pattern before the textbook tells you what to see," Marcus said, gesturing with his tablet. "That's what separates good doctors from great ones. Pattern recognition, instinct, not just following some checklist like a robot." His eyes flicked toward Sarah as she passed. The implication hung in the air. Jason, the resident, jumped in. What about nurses who think they know better than attending physicians? Marcus smiled. Well, Jason, there's a hierarchy in medicine for a reason. Experience matters. Education matters. You can't learn trauma care from counting supplies. More laughter. Sarah kept walking. The night stretched on. A construction worker came in with a nail gun injury. Sarah assisted while Marcus performed the extraction, her hands steady, movements economical. She anticipated what he needed before he asked, had instruments ready, kept the field clean. Marcus didn't acknowledge her contributions. When the procedure finished successfully, he thanked the residents for their excellent support. Around midnight, things slowed down. The waiting room emptied except for a few stragglers with non-urgent complaints. Sarah used the lull to restock trauma rooms, checking equipment with that same meticulous attention that seemed to irritate everyone. You know what your problem is? Sarah turned. Melissa stood in the doorway of Trauma Bay 2, arms crossed. The younger nurse had a way of standing that suggested she was doing Sarah a favor by even speaking to her. My problem? Sarah kept her voice neutral. You act like you're in the military or something. Everything has to be exactly perfect. Everything in its place. It's just a hospital, Sarah. Relax a little. Sarah considered the comment. Melissa wasn't being cruel exactly, just thoughtless in the way young people often are when they haven't yet learned that everyone carries weight they don't show. Preparation prevents mistakes, Sarah said simply. Sure, but you're not saving lives by organizing cabinets. Melissa shifted her weight. Dr. Hale said you should probably work on being more of a team player. Maybe not act like you know better than everyone else. I don't act like I know better. You kind of do, though. The way you check everyone's work, the way you redo things. Melissa's tone softened slightly, like she was offering genuine advice. Just saying, it comes across as condescending. Sarah absorbed this. She'd heard similar feedback before, at other hospitals, in other contexts. The pattern was familiar. Do the job well, stay quiet, and somehow still end up being the problem. I'll keep that in mind, Sarah said. Melissa left. Sarah finished her inventory. Outside, rain began to fall, fat drops that splattered against the ambulance bay windows, then intensified into a steady downpour. Thunder rumbled in the distance. The storm that weather services had been tracking all day was arriving right on schedule. Sarah checked the trauma bay one more time. Airway equipment, ready. Chest tube kits, stocked. Blood warmer, functional. Defibrillator, charged. Every drawer, every cabinet, every emergency supply exactly where it needed to be. She ran through mental checklists that most nurses didn't bother with anymore. Too many steps, too much effort, too paranoid. She wasn't paranoid. She was ready. At 1:15 a.m., Sarah was updating patient charts when the ambulance radio crackled to life. The dispatcher's voice cut through the quiet. Ridgewood Memorial, be advised, incoming priority transport, military escort, ETA, 7 minutes. The charge nurse, an experienced woman named Patricia, looked up from her computer. Military escort? Affirmative. Patient is a 28-year-old male, combat-related injuries, classified mission status. They're requesting your best trauma team. Patricia immediately paged Marcus, who arrived looking annoyed at being pulled from whatever he'd been doing. What's the situation? Military transport, combat injuries, that's all they're telling us. Marcus frowned. Combat injuries? We're in Colorado, not Baghdad. They said classified mission status. Classified. Marcus's irritation was obvious. Great. Probably some training accident they're trying to keep quiet. Get the trauma bay ready. Where's... He looked around. Where's Bennett? Here. Sarah stepped forward from where she'd been standing near the supply station. Trauma Bay 1. Make sure everything's ready. And I mean actually ready, not your obsessive-compulsive version of ready. Sarah moved without responding. Behind her, she heard Marcus talking to the residents. Military cases are usually straightforward. Lots of drama, lots of protocol, but the injuries are generally well documented. The trick is not letting their security theater distract you from doing actual medicine. The rain intensified. Through the ambulance bay windows, Sarah could see sheets of water pouring from the sky, illuminated by periodic lightning flashes. The storm had teeth. She double-checked the trauma bay. Everything was exactly as she'd left it. Everything was ready. At 1:22 a.m., she heard it. The sound was distinct even through the storm, a deep, rhythmic thumping that made the windows vibrate. Helicopter rotors. getting closer. Patricia appeared in the trauma bay doorway. Sarah, they're landing on the roof. This is actually happening. Through the ceiling, the rotor wash was audible even over the rain and thunder. Sarah stood still, listening. The sound triggered something old in her memory. Desert heat and dust clouds and the smell of hydraulic fluid mixed with blood. She pushed it down. Marcus swept into the trauma bay with his resident entourage. All right, people, let's make this look professional. Military brass loves their procedures. We play along, take care of the patient, and send them on their way. He glanced at Sarah. Bennett, you're just assisting. Don't touch anything unless I specifically tell you to. Understood. The elevator from the roof level chimed, doors opened, and everything changed. The soldiers who emerged weren't hospital security or even regular military police. These were operators. Sarah recognized the type instantly. Hard eyes. Efficient movements. The kind of men who carried tension in their shoulders like a loaded weapon. 4 of them, dressed in tactical gear that was wet from the storm, surrounding a gurney being pushed by 2 combat medics. The patient was covered in blood, not the neat, contained bleeding of typical ER cases. This was battlefield trauma. Saturated dressings, crimson streaks across exposed skin, the metallic smell of massive hemorrhage filling the hallway. The patient was restrained at 6 points, straps across chest, waist, and legs. His eyes were open but unfocused. He was making sounds, not screams exactly, but something more primitive. Distress vocals that came from somewhere beyond conscious thought. Trauma 1, Patricia directed, her voice steady despite the controlled chaos. The operators moved with precision, guiding the gurney into the bay. One of them, a man with sergeant stripes and a scar bisecting his left eyebrow, spoke quickly. Patient designation Ghost? 28-year-old male, penetrating trauma to the right thorax, possible pneumothorax. Sustained during classified operation 6 hours ago. Extracted under fire. Initial field treatment performed. He's been increasingly combative during transport. Marcus stepped forward, switching into his command mode. All right, let's transfer on 3. 1, 2. The patient moved. Despite the restraints, despite the blood loss, despite everything that should have made him weak, Ghost suddenly thrashed with terrifying strength. The gurney rocked. One restraint buckle snapped. An operator grabbed the rail to stabilize it. Get him under control, Marcus barked. He's been fighting the restraints for the last hour, the sergeant said. We've avoided heavy sedation due to his respiratory status. They transferred Ghost to the trauma bay bed. The moment the restraints came off for the transfer, he started fighting harder. His right arm swung out, barely missing a resident. His breathing was rapid and shallow, definitely respiratory distress. Jason, get me vitals, Marcus ordered. Melissa, establish IV access. Someone get me his medical history. It's classified, the sergeant said flatly. I can't treat a patient without knowing. You know what you need to know. Penetrating chest trauma. Possible collapsed lung. The rest is above your clearance level. Marcus's jaw tightened, but he turned back to the patient. Ghost was still fighting, his movements becoming more violent. One of the operators had to physically hold his left arm down. We need to sedate him now, Marcus said. I can't work like this. His O2 saturation is dropping, Jason called out, watching the monitors. 89%, 86. Ghost's breathing was becoming more labored. His lips had a dusky quality, classic signs of inadequate oxygenation. But he kept fighting, kept thrashing, his body locked in some kind of survival response that overrode everything else. Someone hold him steady! Marcus reached for examination gloves. I need to assess the chest wound. Ghost's right arm broke free from the operator's grip and swung wildly. The back of his hand caught the edge of a metal tray, sending instruments clattering across the floor. Melissa jumped back with a small scream. This is insane, Marcus muttered. We need 4-point restraints and heavy sedation. Now. His respiratory status won't tolerate, the combat medic started. I don't care what it will or won't tolerate. I can't treat him if he's fighting us. Sarah had been standing near the back wall, watching. Not the patient exactly, watching the whole scene. The way Ghost moved wasn't random. There was a pattern to it. The way his eyes tracked the ceiling lights, the way his breathing hitched at certain sounds, the way his whole body tensed when people moved too quickly in his peripheral vision. She'd seen this before. Dr. Hale, Sarah said quietly. Marcus didn't hear her. He was busy arguing with Jason about medication dosages while Ghost continued to deteriorate. Dr. Hale, Sarah said again, louder. What? Marcus snapped, not looking at her. He's not fighting us. He's back there. Back where? Bennett, this isn't the time for your cryptic. He thinks he's still on the battlefield. Sarah stepped closer. Look at his eye movement. He's tracking threats. The overhead lights, the sudden movements. He's still in combat mode. Marcus stared at her. That's not a medical diagnosis. It's trauma response. And if you sedate him without stabilizing his breathing first, you'll kill him. The room went quiet for just a second. Even Ghost's movement seemed to pause. Marcus's face flushed. You don't give medical advice in my trauma bay. You follow orders. Now either help or get out. His right chest is hyperexpanded, Sarah continued, her voice calm but firm. Decreased breath sounds, tracheal deviation. He's got a tension pneumothorax. You sedate him now, his respiratory drive drops, and he goes into full arrest. I can assess my own patient, then assess him, but do it fast because he's got maybe 2 minutes before that collapsed lung kills him. The monitors seemed to agree with her. Ghost's oxygen saturation was now at 82% and falling. His breathing had become paradoxical, chest and abdomen moving in opposite directions. Classic signs of respiratory failure. Marcus moved to examine Ghost's chest, but the patient's continued thrashing made it nearly impossible. Every time Marcus got close, Ghost would swing or kick or try to sit up. This is impossible, Marcus said. Someone get me 4 units of midazolam. That'll stop his breathing entirely, Sarah said. I said get it. Melissa rushed to comply. The sergeant and his operators exchanged glances. They'd brought their man to what was supposed to be the best trauma hospital in the region, and instead they were watching him die in slow motion while doctors argued. Sarah made a decision. She stepped forward, past Marcus, past the residents, past the operators holding Ghost down. She moved into his line of sight deliberately, making sure he could see her coming. Her limp was barely noticeable now. Adrenaline had a way of burning through old pain. Bennett, step back, Marcus warned. Sarah ignored him. She positioned herself at Ghost's right side, in the space where he could see her clearly without having to turn his head. His eyes were wild, unfocused, seeing things that weren't in this room. Everyone was shouting at her to move, to get back, to stop contaminating the sterile field. Sarah leaned in close. Ghost, she said quietly, just loud enough for him to hear. The mission's over. His movement slowed slightly. His eyes found hers. You're home, Sarah continued, her voice dropping even lower. Stand down, operator. You're home. Ghost's breathing hitched. His wild eyes locked onto her face, and for a moment something cleared in his expression. That's it, Sarah said. Easy. The firefight's over. You made it out. His body began to relax incrementally. The thrashing stopped. His breathing, while still labored, became less chaotic. The trauma bay had gone completely silent. Sarah kept her eyes on Ghost. I'm going to help you breathe. You're going to let me. Understand? Ghost's jaw clenched, then relaxed, something that might have been a nod. Sarah turned to Marcus without raising her voice. Get me a 14-gauge needle and a chest tube kit. Now. For once, Marcus didn't argue. Maybe it was the tone. Maybe it was seeing Ghost actually calm down. Maybe it was the way every operator in the room had suddenly shifted their attention to Sarah with expressions that suggested recognition. Jason handed her the equipment, his hands shaking slightly. Sarah worked with movements that were smooth and precise. She palpated Ghost's chest, found the intercostal space, prepped the site. Ghost watched her, his breathing still shallow, but no longer panicked. This is going to hurt, Sarah told him. But it'll help you breathe. Ready? Ghost's eyes held hers. She saw the understanding there. Sarah performed the needle decompression with the kind of efficiency that comes from doing something hundreds of times under pressure. There was a hiss of escaping air as the tension pneumothorax released. Ghost's chest expanded more fully. The monitor showed his oxygen saturation beginning to climb. 85%. 88. 91 on. Sarah didn't wait for praise. She immediately began setting up for the chest tube insertion, her hands moving through the procedure like it was choreographed. Marcus stood frozen, watching her work. The residents had backed up against the walls. The operators had formed a semicircle, and their body language had shifted from protective to something else entirely. The combat medic who'd ridden in with Ghost spoke softly to the sergeant. Sir, Is that, Yeah, the sergeant said, his voice barely audible. That's her. Sarah inserted the chest tube with practiced precision. Ghost grimaced, but didn't fight. Blood and air drained into the collection chamber. His breathing eased further. The monitors stabilized. Crisis averted. She secured the tube, checked the suction, and updated the settings on the chest drainage system. Only then did she step back. Ghost was stable, still critical, still needing intensive care, but no longer dying. Sarah turned to find the entire trauma base staring at her. Not at the patient, at her. Marcus's mouth was slightly open. Melissa looked pale. Jason seemed confused, like the fundamental rules of the universe had just been rewritten. The sergeant stepped forward. His posture had changed entirely. When he spoke, his voice carried a weight that made everyone in the room stand straighter. "Lieutenant," he said. Sarah's expression didn't change. "I'm not active duty anymore, Sergeant. Once Ghost Angel, always Ghost Angel, ma'am." The sergeant's hand moved toward his forehead in what was clearly going to be a salute before Sarah stopped him with a slight shake of her head. The words hung in the air, Ghost Angel. The call sign seemed to echo off the trauma bay walls. Marcus found his voice, though it came out weaker than usual. "What is he talking about?" The sergeant turned to look at Marcus, and the contempt in his expression was barely concealed. "You really don't know who's been working in your hospital? I know she's a nurse who doesn't follow protocol, and Lieutenant Sarah Bennett," the sergeant interrupted, "served 3 tours with the 75th Ranger Regiment as an elite trauma specialist. Earned a Bronze Star for pulling wounded operators out of a hot LZ under direct fire. Saved 14 lives during the Helmond Valley extraction. Got the call sign Ghost Angel because she appeared out of nowhere when soldiers were dying and kept them alive through situations that should have killed them." The silence that followed was absolute. Sarah stood there, her scrub still spotted with Ghost's blood, her expression carefully neutral. But something had shifted in her posture. The slight hunch she usually carried was gone. She stood straighter now, and the limp seemed to have disappeared entirely. Marcus was staring at her like she was a stranger. "You never said, you never asked." Sarah's voice was quiet, but carried an edge now. "You just assumed the quiet nurse with a limp wasn't worth your time." "I didn't." "You called me outdated this morning. You told me to stop pretending I understood trauma care." Sarah gestured at Ghost, now resting peacefully on the bed, his vital signs stable. "I've treated chest wounds in the back of a Humvee while taking enemy fire. I've performed emergency procedures in conditions you couldn't imagine in your worst nightmares. And you thought counting supplies was beneath the standards of real medicine." Melissa had tears in her eyes. Jason looked like he wanted to disappear into the floor. The sergeant wasn't done. "The limp she has, shrapnel from an IED that hit her convoy. She kept working for 6 hours after the blast before anyone realized she was injured. The only reason she's not still active duty is because the injuries were severe enough to force a medical discharge." He turned back to Sarah. "We've been trying to reach you for the last 2 hours, ma'am. Ghost specifically requested you when he regained consciousness during transport. Said if anyone could keep him alive, it was the Angel." Sarah's carefully controlled expression cracked slightly. "He remembered me. You saved his life in Kandahar. He doesn't forget something like that." Ghost's eyes were open now, more focused than before. He was looking at Sarah with recognition that went beyond the immediate crisis. His lips moved, forming words that barely had sound. Sarah moved to his side. "Don't talk. Save your energy." "No, it was you," Ghost whispered. "The way you moved. Rest. You're going to be fine." Told them, "Only trust Ghost Angel." Sarah's hand found his, squeezed gently. "I've got you. You're safe." The trauma bay remained frozen in this tableau. The nurse who'd been dismissed and mocked for months, now revealed as something entirely different. A combat veteran, a decorated trauma specialist, someone who'd earned respect in the hardest possible way. Marcus tried to recover some authority. "Well, this is all very impressive, but we need to get the patient to ICU and—" "Actually," a new voice interrupted from the doorway. Everyone turned. A man in an army officer's uniform stood there, rain still dripping from his jacket. Older, with silver hair and the kind of bearing that came from decades of command. His name tape read Morrison. His rank insignia showed a full colonel. "Colonel Morrison," the sergeant said, snapping to attention. Morrison's eyes swept the room, taking in the scene with practiced assessment. They landed on Sarah and stopped. "Lieutenant Bennett," he said. "I'm not—" "You'll always be lieutenant to me," Morrison stepped into the room. "I heard the call that Ghost was being transported to Ridgewood Memorial. Took a chance that you might still be here." His gaze shifted to Marcus. "You must be the head of this trauma department." "Dr. Marcus Hale," Marcus said, trying to sound authoritative. "I'm the chief trauma surgeon and the man who's been treating one of my best combat trauma nurses like she's incompetent." Morrison's voice was conversational, but there was steel underneath. "Yes, I've heard about that." Marcus went pale. "I don't know what you've heard, but I've heard enough." Morrison turned back to Sarah. "Your work tonight probably saved Ghost's life. The field medics told me his condition was deteriorating rapidly. Standard hospital protocol wouldn't have worked. He needed someone who understood combat trauma psychology and had the skills to back it up." "I just did what needed to be done," Sarah said quietly. "Which is exactly what you've always done." Morrison glanced at Ghost, who was now receiving oxygen and looking significantly more stable. "When he wakes up fully, he's going to want to thank you properly. That's not necessary. Maybe not, but it's going to happen anyway." Morrison's attention returned to Marcus. "Dr. Hale, I think you and I need to have a conversation, along with your hospital administration." "I don't see why that's—" "Then let me be clear. The military has a contract with Ridgewood Memorial. We send our people here because we trust this facility to provide appropriate care. Learning that one of your staff members, a decorated combat veteran with specialized training, has been systematically undermined and disrespected raises serious questions about your leadership and judgment." Marcus's face cycled through several colors. "Now wait just a minute. I'm not done." Morrison's voice dropped lower, which somehow made it more intimidating. "You had access to expertise that most civilian hospitals would pay dearly for, and instead of utilizing it, you created a hostile work environment. That's not just bad leadership, it's negligence." Patricia, the charge nurse, had been watching everything unfold with wide eyes. Now she spoke up hesitantly. "Colonel Morrison, if I may, Sarah, Lieutenant Bennett, has been exceptional in her work here. Many of us didn't know her background, but her skills have always been evident." "Then why was she being treated like a liability?" Patricia had no answer for that. Neither did anyone else. The rain continued to hammer the windows. Ghost's monitors beeped steadily. The operators stood at attention, watching their fallen brother rest peacefully now, kept alive by a woman who'd been invisible to most of this hospital until 15 minutes ago. Sarah felt the weight of everyone's eyes on her. This wasn't how she'd wanted things to go. She'd taken the job at Ridgewood Memorial specifically because it was quiet, because no one knew her background, because she could just be a nurse and not carry the weight of everything she'd done and seen. But secrets don't stay buried forever, especially not when the past arrives on a helicopter through a thunderstorm, bleeding and calling your name. Marcus was trying to formulate a response when Sarah's radio crackled. Another incoming trauma, a multi-vehicle accident on the highway. The normal chaos of emergency medicine reasserting itself. "We need to clear this bay," Patricia said, falling back on familiar protocols. Morrison nodded. "Ghost will be transported to Walter Reed once he's stable enough for transfer. Until then, I want Lieutenant Bennett included in all decisions regarding his care." "She's a nurse, not a—" Marcus started. "She's the reason he's still breathing," Morrison cut him off. "And unless you want to explain to the Joint Chiefs why you refuse to utilize available expertise, I suggest you adjust your attitude." The look Morrison gave Marcus could have frozen water. They transferred Ghost to the ICU, with Sarah accompanying the transport. The operators went with them, maintaining their protective cordon. As Sarah walked through the hospital corridors with her patient, she noticed other staff members staring. Word was already spreading, the quiet nurse with the limp, the one Marcus Hale had been mocking for months. She'd just performed battlefield trauma care that saved a dying soldier's life. In the ICU, Sarah gave detailed handoff to the receiving nurses, walking them through every intervention she'd performed, every medication that had been administered, every detail of Ghost's current condition. She spoke with calm authority now, no longer hiding her competence behind careful neutrality. When she finished and turned to leave, Ghost's hand caught her wrist. His grip was weak but deliberate. "Thank you," he whispered. Again. Sarah smiled, a real smile, warm and genuine. "Rest. That's an order." "Yes, ma'am." She walked out of the ICU to find Colonel Morrison waiting in the hallway. "Walk with me," he said. They moved through the hospital's corridors, Morrison's presence parting staff members like water. Sarah had forgotten what it felt like to walk beside someone who commanded that kind of automatic respect. "You've been hiding here," Morrison said. It wasn't a question. "I've been working here. There's a difference between working and hiding, Lieutenant. You're doing the latter." Sarah didn't respond. "The shrapnel wounds healed well?" Morrison asked. "Well enough." "The limp?" "Nerve damage. It comes and goes." "And the rest of it?" Morrison stopped walking, turned to face her directly. "How are you really?" Sarah met his eyes. Morrison had been her commanding officer during her second tour. He'd written the recommendation that got her into the specialized trauma program. He'd also been the one who visited her in the hospital after the IED blast and told her that her active duty career was over. "I'm managing," Sarah said. "Managing isn't thriving." "It's enough." Morrison studied her for a long moment. "You saved a lot of lives over there, Sarah. You earned the right to stop carrying all of it alone." "I'm not—" "Yes, you are. You came here to disappear, to be invisible, to pretend that everything you did and everything you saw doesn't matter anymore." Morrison's voice softened. "But it does matter. And pretending otherwise isn't healing. It's just hiding." Sarah felt something tighten in her chest. She'd spent 8 months being small, being quiet, being dismissible. It had seemed easier, safer, less complicated than acknowledging who she'd been and what she'd done. "I didn't want to be Lieutenant Bennett anymore," she said quietly. "I wanted to just be Sarah. A nurse. Nothing special." "You'll never be nothing special. That's not how you're built." Morrison paused. "But you shouldn't have to choose between being respected and finding peace. You deserve both." Before Sarah could respond, her radio crackled again. The highway accident patients were arriving, all hands needed in the ER. Morrison nodded. "Go, but this conversation isn't over." Sarah hurried back toward the emergency department. The storm outside was reaching its peak, thunder shaking the building's foundations. When she pushed through the trauma bay doors, she found controlled chaos. Multiple stretchers, multiple patients, everyone moving with purpose. Marcus was in trauma too, already working on a patient. He looked up when Sarah entered, and their eyes met across the organized chaos. Something had shifted. Sarah could see it in the way he held himself, the uncertainty in his expression. The easy arrogance was gone, replaced by something more complicated. But there was no time to address it. People were bleeding. People needed help. And regardless of what had happened or what would happen next, Sarah was still a nurse, still trained to save lives. She moved to Trauma 3, where a young woman with severe abdominal injuries was being prepped. The attending physician there, Dr. Karen Winters, one of the few people who'd never dismissed Sarah, looked relieved to see her. "I need your best work," Dr. Winters said. "You've got it." They worked together seamlessly, Sarah's hands moving with precision and confidence she no longer bothered to hide. Around them, the ER buzzed with new energy. Staff members kept glancing at Sarah, seeing her differently now. The invisible nurse had become visible in a way that couldn't be ignored. 2 hours later, when the last patient from the highway accident was stabilized and transferred, Sarah found herself alone in the break room. Her scrubs were stained with multiple people's blood. Her hands trembled slightly from adrenaline come-down. She sat on the worn couch and let her head fall back against the wall. The door opened. Marcus stood there, his own scrubs similarly stained. He looked exhausted. And something else, uncertain in a way Sarah had never seen before. "Can I—" He gestured at the room. "Can I come in?" Sarah shrugged. "It's a shared space." Marcus entered, but didn't sit. He stood awkwardly near the door like he wasn't sure what to do with his hands. "I didn't know," he finally said. "You didn't ask." "That's not an excuse." "No, it's not." Marcus ran a hand through his hair, messing up the perfect styling. I should have... The way I treated you was unprofessional." Sarah waited. She wasn't going to make this easy for him. "You saved that soldier's life tonight," Marcus continued. "The way you handled it, the way you just knew what to do." I wouldn't have figured it out in time. I would have sedated him, and he would have died, Sarah finished. Yeah. Marcus looked at the floor. I thought I was the expert, the one who knew everything, and I missed it completely. You're a good surgeon, Sarah said, and she meant it. But surgery isn't the same as battlefield trauma. Different training, different instincts. You could have mentioned your background when you started here. Would it have mattered? The question hung between them. Marcus opened his mouth to answer, then closed it. Because they both knew the truth, it probably wouldn't have mattered. He would have still been arrogant, still looking for someone to elevate himself above, still needing to prove he was the smartest person in the room. I don't know, Marcus admitted quietly. Maybe not. And that's... He trailed off. That's what? Sarah prompted. That's shameful. That I might have treated you the same way even if I'd known you were a decorated combat veteran, because the problem wasn't what I knew about you. The problem was me. Sarah studied him. This vulnerability was new, possibly genuine, possibly just fear of the consequences Morrison had promised. Hard to tell. What happens now? Marcus asked. I don't know. That depends on a lot of things that aren't up to me. Will you stay? At Ridgewood? Sarah hadn't considered that question yet. 8 months of being dismissed, of being treated like she was barely competent, of watching residents laugh at her methodical approach to patient care. Did she want to stay after all that? Even if things changed, even if Marcus changed, would it be enough? I haven't decided, she said honestly. Marcus nodded slowly. If you do stay, I'll do better. I'll be better. Maybe. Or maybe you'll just be more careful about who you mock in front of witnesses. The words were harsh but fair. Marcus flinched slightly, then nodded again. I probably deserve that. You definitely deserve that. He moved toward the door, then paused. For what it's worth, you were right about the equipment checks, about the preparation, about, he gestured vaguely, about most things, probably. I was too arrogant to see it. Then he left, leaving Sarah alone in the break room with her thoughts and her exhaustion. She pulled out her phone and stared at the dark screen. There were people she could call, other veterans she'd served with, fellow nurses from her military days. Morrison would probably answer if she needed to talk. But Sarah had spent so long being alone with all of it that reaching out felt foreign now, uncomfortable, like asking for help was admitting defeat. The storm outside was beginning to ease. The thunder had moved on to rattle someone else's windows. In the ICU upstairs, Ghost was resting, kept alive by her skills, and her refusal to let past trauma prevent her from acting. Sarah thought about what Morrison had said, about hiding versus working, about carrying everything alone. Maybe he was right. Maybe she had been hiding, taking the quiet job, staying invisible, never letting anyone see the person she'd been or the things she'd done. It had seemed easier, safer. But easy and safe hadn't protected her from Marcus's cruelty, hadn't stopped the residents from laughing at her methodical preparation, hadn't prevented the loneliness that came from being invisible. Her radio crackled. Another call. Another patient. The endless rhythm of emergency medicine. Sarah stood, her left leg protesting slightly. The limp was back now that the adrenaline had faded. She ignored it, the way she'd learned to ignore a lot of things. But as she walked back toward the trauma bay, she walked differently than she had that morning. Her shoulders were back. Her head was up. She was done being invisible. The night shift was far from over, and somewhere in the hospital's administrative offices, conversations were happening that would determine her future here. Decisions were being made. Consequences were forming. Sarah had faced worse than hospital politics. She'd treated soldiers under fire, performed surgery in the back of moving vehicles, kept people alive through situations that should have killed them. Whatever came next, she would handle it. Not by hiding. Not by staying small. By being exactly who she was. Ghost Angel, the nurse who appeared when death was coming and refused to let it win. The trauma bay doors opened in front of her, and Sarah stepped through them without hesitation, ready for whatever the rest of the night would bring. The next patient was a teenager with a fractured femur from the highway pileup, screaming through the pain while his mother stood outside the trauma bay, sobbing into her phone. Sarah worked alongside Dr. Winters, stabilizing the leg, managing pain levels, keeping the kid conscious and calm enough to answer questions about allergies and medical history. The boy kept asking if he'd ever walk again. Sarah told him yes, told him the truth without sugarcoating it. Surgery, rehab, 6 months minimum. He appreciated the honesty more than empty reassurance. When they'd done everything they could and wheeled him toward the OR, Sarah noticed staff members watching her with different eyes. Not dismissive anymore. Not amused. Cautious, maybe. Curious, definitely. Word had spread faster than infection through the hospital's informal networks. The quiet nurse wasn't so quiet. The woman Marcus Hale had been humiliating for 8 months had just performed emergency battlefield procedures that saved a life he would have lost. By 4 a.m., the ER had finally calmed. Sarah stood at the central station updating charts when she felt someone approach from behind. She turned to find Jason, the resident who'd laughed the loudest at Marcus's jokes, standing there with his expensive sneakers and his uncomfortable expression. "Can I talk to you?" he asked. Sarah waited. Jason shifted his weight. "I wanted to apologize for how I acted, the things I said, the way I didn't know." "Would it have mattered if you did know?" The question clearly caught him off guard. He opened his mouth, closed it, tried again. "I'd like to think it would have." "But you're not sure?" "No," Jason admitted quietly. "I'm not sure. I followed Dr. Hale's lead because he's the attending, and I'm trying to get a good recommendation. That's not an excuse, that's just what happened." Sarah appreciated the honesty, even if it wasn't particularly flattering. "You're going to be a doctor soon. Maybe think about what kind of doctor you want to be. The kind who treats everyone with respect, or the kind who only respects people after they prove themselves in dramatic ways." Jason absorbed this. "I'll do better." "Good." He left. Melissa appeared 20 minutes later with a similar apology, though hers came wrapped in more justifications about following workplace culture and not understanding the full situation. Sarah listened without offering absolution. Some things couldn't be fixed with a quick sorry. The shift change came at 7 a.m. Sarah gave report to the day nurse taking over her patients, detailing everything with the same precision she always had. The day nurse, a woman named Rita who'd been friendly enough in a distant way, kept staring at Sarah like she'd never actually seen her before. "Is it true?" Rita finally asked. "What they're saying about you?" "Depends on what they're saying. That you were some kind of elite military trauma specialist, that you served in combat zones. It's true." Rita shook her head slowly. "And you've just been working nights here, taking assignments nobody else wanted, never saying anything about your background." "I was doing my job." "You were doing everyone's job. I've seen you pick up slack for 3 different nurses on the same shift." Rita's expression shifted to something like guilt. "We all just thought you were, I don't know, overeager, trying too hard." Sarah had heard variations of this before. "Do your work well and stay quiet, and people assume you're compensating for inadequacy. Do your work well and talk about it, and you're arrogant." There was no winning configuration. "I'm going home," Sarah said simply. She changed out of her scrubs in the locker room, pulling on jeans and a worn gray sweatshirt. Her civilian clothes always felt strange after a shift, like putting on a costume of normalcy. She grabbed her bag and headed for the exit, exhaustion settling into her bones. Colonel Morrison was waiting in the parking lot. He leaned against a black SUV, still in uniform despite the early hour. Rain had stopped but left everything wet and reflecting the pale morning light. Morrison straightened when he saw Sarah approach. "You're not going to let this go, are you?" Sarah asked. "Not a chance, Lieutenant." "I'm not. Old habits." Morrison gestured at the SUV. "Let me buy you breakfast. We need to talk." Sarah wanted to refuse, wanted to go home and sleep for 12 hours and pretend the last shift had been normal. But Morrison had flown here specifically, had shown up in the middle of the night to support one of his former soldiers. Refusing felt wrong. "Fine," she said, "but somewhere quiet." They found a diner 3 miles from the hospital, the kind of place that served truck drivers and insomniacs, and people whose schedules didn't align with normal human rhythms. Morrison ordered coffee and eggs. Sarah got pancakes she wasn't sure she could eat. "Ghost is stable," Morrison said after the waitress left. "Talked to the ICU attending an hour ago. They're impressed with your work." "It wasn't complicated." "It was exactly complicated, just not for you." Morrison added cream to his coffee with practiced movements. "You know what's going to happen now, right? Hospital administration will launch an investigation into Marcus, maybe suspend him, Maybe just give him a warning. Either way, things will be awkward. That's part of it. The other part is that your story is going to spread. Decorated combat nurse working at a civilian hospital saves dying operator while the arrogant surgeon watches helplessly. That's the kind of narrative people love. Sarah felt her stomach tighten. I don't want to be a narrative. Too late. You already are. Morrison's expression softened. I know you came here to escape attention, to just be normal. But Sarah, you were never going to be normal, not after everything you've done. I can't live as Lieutenant Bennett anymore. That person, she doesn't exist in the same way. Maybe not. But Sarah Bennett who pretends she's ordinary doesn't exist either. You're somewhere in between, and the sooner you accept that, the easier things get. Their food arrived. Sarah pushed her pancakes around without eating. Morrison worked through his eggs methodically, giving her space to think. What if I quit? Sarah asked quietly. Find another hospital, start over somewhere new. You could do that. You could keep running, keep hiding, keep pretending. Morrison set down his fork. Or you could stay and make Ridgewood Memorial understand what they actually have. A trauma specialist with battlefield experience. Someone who can train their staff, improve their protocols, save lives they'd otherwise lose. They don't want that. They want nurses who follow orders and don't make waves. Marcus Hale wanted that. The hospital might want something different once they understand their options. Sarah finally took a bite of pancake. It tasted like cardboard, but she forced herself to swallow. And if they don't? Then you leave with your head up, knowing you gave them the chance. Morrison leaned forward. But you don't run before finding out. You've never run from anything in your life. Don't start now. The diner's TV was playing morning news with the sound off. Headlines scrolled past about weather and politics and sports scores. Normal life continuing for people who hadn't spent the night keeping someone alive while old wounds reopened. I'm tired, Sarah said, and she meant it in ways that went beyond lack of sleep. I know you are, but tired isn't the same as broken. Morrison drove her back to her apartment, a modest one-bedroom in a complex that catered to hospital staff. He walked her to her door despite her protests. Get some rest, he said. I'll be in town for a few days. We'll talk more. Sarah nodded, too exhausted to argue. Inside her apartment, she dropped her bag and stood in the small living room without turning on lights. The space was impersonal, basic furniture, no photos on the walls, nothing that suggested anyone actually lived here versus just temporarily occupied the space. She'd been in Silver Ridge for 8 months and hadn't bothered to make this place feel like home, because it wasn't home. Nowhere had felt like home since the IED blast ended her military career and sent her into this strange civilian existence where nothing quite fit right. Sarah showered, washing off the night's accumulated sweat and blood and stress. The hot water felt good on her back, where old scars pulled tight when she was tense. She'd stopped looking at them years ago. No point dwelling on permanent reminders. She tried to sleep, but her mind wouldn't stop replaying the night. Ghost's wild eyes finding hers. The tension pneumothorax releasing. Marcus's face when he realized who she actually was. Morrison's words about running versus staying. At noon, her phone rang. Hospital administration. Sarah stared at the screen for 3 rings before answering. Ms. Bennett, this is Helen Rodriguez from HR. Do you have time to come in this afternoon? We'd like to discuss last night's events. Sarah closed her eyes. Here it came. What time? 2 p.m., Director Walsh's office. I'll be there. She dressed carefully, slacks and a button-down shirt, professional but not trying too hard. The limp was more pronounced after only 4 hours of sleep, her left leg dragging slightly as she moved through her apartment. She took ibuprofen and ignored it. The drive back to Ridgewood Memorial felt surreal. 12 hours ago, she'd been trying to stay invisible. Now she was heading into a meeting that would probably determine whether she still had a job. Director Walsh's office was on the administrative floor, all glass walls and expensive furniture that suggested budgets were allocated differently up here than down in the ER. Walsh herself was a woman in her 50s with sharp eyes and perfectly styled silver hair. 2 other people sat in the office, Helen Rodriguez from HR and someone Sarah didn't recognize, a man in a suit who introduced himself as the hospital's legal counsel. Great, lawyers already. Thank you for coming in on your day off, Walsh said, gesturing for Sarah to sit. I understand you worked a difficult shift last night. Sarah sat, keeping her expression neutral. It was busy. I've received several reports about events in the trauma bay, a military patient, an emergency procedure, some revelations about your background. Walsh folded her hands on her desk. I'd like to hear your version. Sarah walked them through it. The helicopter arrival, Ghost's deteriorating condition, Marcus's initial approach, her intervention. She kept it clinical, factual, avoiding editorializing even when it would have been easy to make Marcus look worse. Walsh listened without interrupting. The lawyer took notes. Rodriguez watched Sarah with an expression that was hard to read. When Sarah finished, Walsh leaned back in her chair. Why didn't you mention your military service when you applied here? It wasn't relevant to the nursing position? 3 tours as a specialized trauma nurse isn't relevant to working in an emergency department? I have all the civilian certifications required for the job. My military experience is in my employment history. I didn't hide it. I just didn't advertise it. But you also didn't correct Dr. Hale when he dismissed your clinical judgment on multiple occasions. Sarah felt anger flicker in her chest. Dr. Hale is an attending physician. I'm a staff nurse. Correcting him publicly would have been inappropriate. Even when lives were at stake. I followed proper protocols. When I had concerns about patient care, I documented them and escalated through proper channels. Walsh opened a folder on her desk. I've reviewed your incident reports from the last 8 months. You filed 14 formal concerns about trauma protocols, staffing decisions, and equipment maintenance. All of them were dismissed or ignored. Sarah hadn't expected this. I wasn't aware you'd reviewed those. We didn't until this morning. Once we started looking into last night's events, patterns emerged. Walsh pulled out several pages. Your concerns were consistently valid. In 3 cases, issues you flagged resulted in near misses that could have been prevented if someone had listened. The lawyer shifted in his seat. Ms. Bennett, did you at any point feel that Dr. Hale's treatment of you created a hostile work environment? This was a trap. Answer yes, and she'd be dragged into an official complaint process. Answer no, and she'd be undermining any consequences Marcus might face. Dr. Hale's management style was challenging, Sarah said carefully, but I focused on doing my job. That's not what I asked. Sarah met the lawyer's eyes. Yes, his treatment created a hostile work environment. He publicly mocked my clinical judgment, dismissed my input in front of other staff, and created a culture where residents felt comfortable doing the same. It made it harder to do my job effectively. Rodriguez wrote something down. Walsh's expression didn't change. Several staff members have come forward this morning, Walsh said. Residents, nurses, even an attending physician. They've corroborated your account of Dr. Hale's behavior. They've also expressed remorse for participating in or enabling that behavior. That's good of them, Sarah said, and couldn't quite keep the edge out of her voice. We're conducting a formal investigation into Dr. Hale's conduct, Walsh continued. He's been placed on administrative leave pending the outcome. This isn't punitive yet, it's procedural. But I want to be clear that we take these allegations seriously. Sarah nodded. She felt nothing. No satisfaction, no vindication. Just tired. What happens to me? She asked. Walsh looked surprised. Why would anything happen to you? I performed a procedure without direct physician supervision. I technically overrode Dr. Hale's treatment plan. You saved a patient's life using skills acquired through legitimate medical training, Walsh said. That's not a violation. That's excellence in nursing practice. The lawyer cleared his throat. Ms. Bennett, we'd like to discuss your future at Ridgewood Memorial. Specifically, we're interested in creating a position that would better utilize your specialized expertise. Sarah blinked. I'm sorry? Walsh took over. We're proposing a new role, trauma coordinator. You'd oversee protocol development, staff training, and serve as a clinical resource for complex trauma cases. It would come with a significant raise and more authority to implement changes you think are necessary. This wasn't what Sarah had expected at all. You want to promote me? We want to stop wasting your talents, Walsh said bluntly. Last night exposed major gaps in our trauma program. You identified and addressed a critical condition that our attending physician missed. That's not something we can ignore. Sarah's mind was racing. More authority meant more visibility. More visibility meant more questions, more attention, more of the spotlight she'd been avoiding. I need to think about it, Sarah said. Of course. Take a few days. Walsh stood, extending her hand. But I hope you'll stay, Ms. Bennett. Ridgewood Memorial needs people like you. Sarah shook her hand and left, feeling disconnected from her own body. In the hallway outside Walsh's office, she nearly collided with Marcus. He looked terrible. Rumpled clothes, dark circles under his eyes, the carefully maintained appearance completely gone. For a moment they just stared at each other. "They told me you were here," Marcus said quietly. "I didn't ask for any of this." "I know, that somehow makes it worse." He ran a hand through his hair. "I've been thinking about what you said, about whether I would have treated you differently if I'd known your background. And the honest answer is, I don't know. Maybe, maybe not. Either way, it says something pretty damning about me." Sarah didn't disagree. "I'm probably getting fired," Marcus continued. "Walsh was pretty clear about that likelihood, and I guess I deserve it. But I wanted you to know that I'm sorry, really sorry. Not because I got caught or because there are consequences, because I was wrong. About you. About a lot of things." "Okay," Sarah said. "That's it? Just okay?" "What do you want me to say, Marcus? That it's fine? That I forgive you? That we can move past this and be colleagues?" Sarah shook her head. "You spent 8 months making me feel worthless. You created an environment where other people thought it was acceptable to dismiss everything I said. You nearly killed a patient last night because you were too arrogant to listen. So yeah, okay, you're sorry. I heard you." Marcus looked like he'd been struck. "I can't change what I did." "No, you can't." Sarah walked away, leaving him standing in the hallway alone. Her hands were shaking. 8 months of swallowed words and absorbed insults were pushing up through her throat, wanting out. But this wasn't the place, not with lawyers and HR and hospital politics swirling around everything. She made it to her car before the trembling spread through her whole body. Not fear, not sadness. Just the physical manifestation of stress finally finding an outlet. She sat behind the wheel and breathed until it passed. Her phone buzzed. A text from Morrison. "How'd it go?" Sarah stared at the question. How had it gone? They'd offered her a promotion. They'd put Marcus on leave. They'd acknowledged that she'd been right about everything. By any objective measure, she'd won. So why did she feel hollowed out? She drove home without answering. Inside her apartment, she finally collapsed onto the couch and let herself feel the full weight of everything. The exhaustion, the anger, the complicated relief of finally being seen mixed with the resentment that it took a dying soldier and a dramatic rescue to make anyone look at her properly. Sleep came in fragments, punctuated by dreams of desert dust and helicopter rotors and Ghost's wild eyes finding hers in the chaos. She woke to pounding on her door. Disoriented, Sarah checked her phone. 8 p.m. She'd slept 6 hours. The pounding continued. Through the peephole, she saw Morrison, and something about his expression made her yank the door open immediately. "What's wrong?" "Ghost took a turn," Morrison said. "They need you at the hospital. Now." Sarah was moving before Morrison finished speaking, grabbing her keys and shoes while her brain snapped from sleep fog to combat clarity in seconds. They took Morrison's SUV, the colonel driving faster than was strictly legal through Silver Ridge's evening traffic while explaining what little he knew. Sudden respiratory distress. Oxygen saturation dropped to 70%. They intubated him, but he's fighting the ventilator. How long ago? 20 minutes. ICU called me 15 minutes ago when they couldn't stabilize him. Sarah's mind ran through possibilities. Pneumothorax recurrence, pulmonary embolism, sepsis, complications from the chest tube. Any of them could kill Ghost within the hour if not managed correctly. Morrison ran a red light. Nobody commented. They reached Ridgewood Memorial in 8 minutes. Sarah was out of the SUV before it fully stopped, moving through the emergency entrance with Morrison half a step behind. Staff members turned to stare as she passed, but Sarah ignored them, heading straight for the ICU elevator. The ICU on the 4th floor was controlled chaos. Alarms screamed from Ghost's room. Through the glass walls, Sarah could see 4 people crowded around his bed. 2 nurses, a respiratory therapist, and an attending physician she didn't recognize. Ghost was thrashing against restraints while the ventilator alarm shrieked its warning that the patient was fighting the machine. Sarah pushed through the door. "What's his current status?" The attending, a thin man with wire-rimmed glasses whose name tag read Dr. Patel, looked up with obvious relief. "You're Bennett? Thank God. He decompensated 30 minutes ago. We intubated, but he's bucking the vent. Oxygen sat won't climb above 75 even on 100% FiO2. Sarah moved to Ghost's bedside, her eyes scanning the monitors while her hands automatically checked the ventilator settings. His heart rate was 140, blood pressure elevated, pupils dilated. Every muscle in his body was rigid with tension. "Talk me through what happened before the decompensation," Sarah said, adjusting the sedation drip. One of the nurses, a young man who looked scared, spoke quickly. "He was stable all day. Vitals good, chest tube draining appropriately. Then around 7:30 he became agitated, started pulling at his IV lines. We gave him Ativan, but it didn't touch him. His breathing got worse fast." Sarah checked the chest tube. Still patent, still draining. She auscultated his lungs, decreased breath sounds on the right side again, but not absent. She palpated his chest wall, feeling for subcutaneous emphysema. There, crackling under the skin near the tube insertion site. "He's got an air leak," Sarah said. "The tube's migrated or he's developed a new pneumothorax." "We did a chest x-ray 20 minutes ago," Patel said, pulling it up on the computer screen. "Tube looks appropriately placed." Sarah studied the image. Patel was right. The tube was in the correct position. But Ghost's clinical presentation didn't match. His oxygen saturation should be better. His agitation suggested something was being missed. "What sedation is he on?" Sarah asked. "Propofol at 50 mics per kilo per minute. We pushed fentanyl twice. It's not working because he's not agitated from pain or anxiety." Sarah leaned closer to Ghost, watching his eye movements, the way his pupils tracked erratically. "He's hypoxic, and his brain is interpreting it as a threat. He thinks he's under attack." Morrison had entered the room quietly, standing near the door with the operators who'd accompanied Ghost from the field. They watched Sarah work with expressions that suggested they'd seen her do this before. Sarah increased the propofol drip and added a paralytic. "We need to chemically paralyze him long enough to figure out what's wrong. His fighting is making everything worse." "That's risky," Patel said. "If we paralyze him and miss something, if we don't paralyze him, he'll code in the next 10 minutes. Sarah's voice was calm but absolute. "Start vecuronium, 0.1 milligrams per kilo." Patel hesitated only a second before nodding to the nurse, who drew up the medication. They pushed it through the IV. Within 90 seconds, Ghost's thrashing stopped. His muscles went slack. The ventilator alarms quieted as the machine could finally deliver breaths without fighting the patient, but his oxygen saturation stayed at 76%. Sarah studied the monitors, her mind moving through differential diagnoses with methodical precision. Not a simple tube malposition, not a recurrent pneumothorax based on the X-ray. Something else. "When did you last flush the chest tube?" she asked. The young nurse checked his notes. 2 hours ago. It was draining well." Sarah examined the drainage system more closely. The tube itself showed minimal output in the collection chamber, maybe 20 milliliters in the last hour. For a fresh chest injury, that was too little. Either the bleeding had stopped completely or something was blocking drainage. "Get me a 60 ml syringe and sterile saline," Sarah said. She carefully disconnected the drainage system and attempted to flush the chest tube. Resistance. The tube was occluded, probably a blood clot blocking the internal lumen. That meant blood and air were accumulating in Ghost's chest cavity, with no way to drain, building pressure, collapsing his lung from the inside. "The tube's clotted off," Sarah said. "We need a new one. Now." Patel's eyes widened. "You want to place another chest tube while he's this unstable?" "I want him to survive the next hour." "That requires a functioning chest tube." Sarah was already moving toward the supply cabinet, pulling out a thoracotomy tray. "We can try to clear this one, but if the clot's solid, we'll waste time we don't have." Morrison stepped forward. "What do you need?" "Clear the room except essential personnel. We need space to work." Sarah began setting up her equipment with movements that were automatic from repetition. "And someone page Dr. Winters. Tell her I need a surgeon standing by in case this goes sideways." The room cleared quickly. Patel stayed, along with the respiratory therapist and one nurse. Morrison and the operators moved to the hallway but remained visible through the glass, watching. Sarah prepped a new insertion site, one intercostal space lower than the original tube. She infiltrated local anesthetic even though Ghost was paralyzed and sedated. Old habits from field medicine where you did everything possible to minimize trauma. "His pressure's dropping," the nurse called out. 90/50. Expected. The tension is affecting his cardiac output. Sarah made her incision with steady hands, deepening through tissue layers until she reached the pleural space. Dark blood welled up immediately. Suction. The respiratory therapist provided suction while Sarah worked. She created the tract for the new tube, feeling the resistance of muscle and fascia give way. This was delicate work made harder by Ghost's critical condition. One wrong move and she could lacerate an intercostal artery or puncture the lung further. "Sats are down to 71, Patel said, his voice tight. Sarah didn't respond. She was insurrecting the new chest tube, advancing it carefully into the pleural space. It slid in smoothly. She connected the drainage system and immediately dark blood began flowing into the collection chamber, 200 milliliters in the first 30 seconds. "There," Sarah said. He was bleeding into his chest and the clotted tube wasn't draining it. Ghost's oxygen saturation began climbing. 74, 78, 82. His blood pressure stabilized. The monitors stopped screaming. Patel exhaled hard. "How did you know?" "Clinical signs didn't match the imaging. When that happens, trust what you can see and feel over what the picture shows." Sarah secured the new tube and dressed the insertion site. Pictures lie. Bodies don't. She stepped back, stripping off her gloves. Her hands were steady, but she could feel the adrenaline crash approaching. Ghost was stable now, truly stable, not the fragile equilibrium they'd been maintaining before. Morrison entered the room again. "That was close." "Too close." Sarah checked the monitors one more time. "He needs to go to a trauma center, somewhere with CT surgery capability. We're managing complications, but we're not equipped for what he might need next. Walter Reed is sending a transport team. They'll be here by tomorrow morning." Morrison looked at Ghost's unconscious form. "You just bought him the time to make that trip." Dr. Winters arrived 10 minutes later, assessed the situation, and gave Sarah an approving nod. "Heard you had excitement up here. Nice work." "Just doing what needed doing." "That seems to be your specialty." Winters glanced at Patel. "What's the plan for overnight monitoring?" Patel looked at Sarah. "I'd like Bennett to stay involved if she's willing. He clearly responds to her care." Sarah wanted to refuse, wanted to go home and sleep and not spend another minute in this hospital dealing with medical crises and complicated politics. But Ghost was lying there paralyzed and intubated because she'd made the call to chemically restrain him and she couldn't walk away until she was sure he'd stabilize. "I'll stay," she said. "But I'm not on the clock. I'm here as a consultant." "Whatever works," Patel said quickly. The hours that followed were a strange limbo. Sarah stayed in the ICU, monitoring Ghost's condition while the paralytic wore off. When he began breathing over the ventilator, a good sign, they reduced the sedation slightly. His vital signs remained stable. The new chest tube drained appropriately. Small victories that added up to survival. Around midnight, Sarah was updating Ghost's flow sheet when she sensed someone watching. She looked up to find one of the operators standing in the doorway, the sergeant with the scar, still in tactical pants and a black t-shirt that suggested he hadn't left the hospital since yesterday. "He's going to make it," the sergeant said. It wasn't a question. "If he doesn't develop sepsis or throw a clot or have another complication, yes. He's got a decent chance." The sergeant stepped into the room, moving quietly for a large man. "You don't remember me, do you?" Sarah studied his face. Something familiar in the set of his jaw, the way he carried himself. "Helmand Province," the sergeant said. 2019. You pulled me out of a destroyed Humvee after an RPG hit. Kept me from bleeding out while we waited for dust-off." The memory surfaced. Smoke and fire and a young soldier with a leg nearly severed at the thigh. She'd used her belt as a tourniquet and kept pressure on his femoral artery for 40 minutes while taking sporadic fire. "Sergeant Rivera," Sarah said quietly, "you do remember." "Hard to forget someone whose blood was all over your hands." Rivera smiled slightly. "Doc said I'd lose the leg. You told me that was bullshit. You were right." "You kept it?" "Still got it. Still use it. Got a nice scar and a limp when it rains, but it works." Rivera looked at Ghost. "When they told me we were bringing him here and I saw your name on the staff list, I thought maybe it was a different Bennett. Then I saw you work last night, and I knew." Sarah didn't know what to say to that. "The men you saved," Rivera continued, "we don't forget. There's maybe 15 guys alive because of you. We talk sometimes. Share stories. Ghost has told his version of Kandahar about 100 times. I was just doing my job. That's what you always say. Rivera's expression turned serious. But it was never just a job to you. You cared whether we lived or died. Not every medical officer did. Some were counting days until rotation ended. You were trying to get everyone home. The words hit harder than Sarah expected. She'd spent so long trying to be invisible, trying to make her military service irrelevant, that she'd almost convinced herself it hadn't mattered, that she'd been replaceable, that any competent trauma nurse could have done what she did. But Rivera's presence, alive, walking, whole, suggested otherwise. Thank you, Sarah said, because nothing else seemed adequate. Rivera nodded and left her alone with Ghost and the quiet beeping of monitors. At 3 a.m., Sarah was fighting sleep when her phone buzzed. A text from an unknown number. This is Helen Rodriguez from HR. Sorry for the late contact. Director Walsh wants to meet with you tomorrow at 10 a.m. Important developments regarding your situation. Please confirm. Sarah stared at the message. Important developments could mean anything. She confirmed and tried not to speculate. Ghost's sedation was light enough now that his eyes would occasionally flutter open. Each time, Sarah made sure she was in his line of sight, speaking quietly to orient him. The ventilator was doing most of the work, but he was contributing, which meant his respiratory drive was intact. Dr. Patel returned at 6 a.m. for morning rounds. He examined Ghost, reviewed all the overnight data, and looked genuinely impressed. Zero complications since the tube replacement, he said. His numbers are actually better than they were yesterday before the decompensation. Sometimes the body just needed the right support to start healing itself, Sarah said, or the right person providing that support. Patel closed his laptop. Walsh told me they offered you a trauma coordinator position. Word traveled fast. She did. You should take it. We need someone who actually understands this work. Patel hesitated. I've been practicing for 12 years, and I missed the occluded tube. Would have kept throwing medications at him until he coded. You saw it in minutes. Different training, different experience. It's more than that. You think like someone who's been in situations where missing the diagnosis means watching someone die. That changes how you practice medicine. Patel glanced at Ghost. Changes it for the better, in my opinion. Sarah went home at 7 a.m., exhausted in ways that sleep wouldn't fully fix. She showered, changed into clean clothes, and forced herself to eat something before heading back to Ridgewood Memorial for the 10 a.m. meeting. Director Walsh's office felt different this time. Less like an interrogation, more like a negotiation. Walsh sat behind her desk with Helen Rodriguez and someone new, a woman in her early 40s with sharp eyes and an expensive suit. Sarah, this is Victoria Brennan, Walsh said. She's on Ridgewood Memorial's board of directors. Brennan stood to shake Sarah's hand. I've heard remarkable things about you. Please, sit. Sarah sat, wary of where this was going. Walsh folded her hands on her desk. We've completed our preliminary investigation into Dr. Hale's conduct. The findings are troubling. Multiple staff members confirmed a pattern of harassment, professional intimidation, and creation of a hostile work environment. His treatment of you was particularly egregious, but you weren't his only target. What happens to him? Sarah asked. He's been terminated, Walsh said flatly. Effective immediately. His behavior violated multiple hospital policies and created liability we can't ignore. Sarah felt something complicated twist in her chest. She'd wanted consequences, but the finality of termination still felt heavy. We're also restructuring our trauma department, Brennan added. The gaps exposed by recent events are unacceptable. We need leadership that prioritizes patient outcomes over ego. She leaned forward. We want you to build that leadership team. I thought the offer was trauma coordinator. It was. We're revising the offer. Brennan slid a folder across the desk. Director of Trauma Services. You'd oversee all trauma protocols, training programs, and quality improvement initiatives. You'd have authority to hire, promote, and implement changes as you see fit. Significant salary increase, benefits package, and autonomy to shape the department. Sarah opened the folder. The numbers were substantial, nearly double her current salary. The job description was comprehensive, covering everything from clinical oversight to staff development to community outreach. This is a leadership position, Sarah said slowly. I'm a nurse, not a physician. You're a trauma specialist with battlefield experience and demonstrated clinical excellence, Brennan corrected. Your credentials are equivalent to or exceed those of most trauma surgeons in terms of practical expertise. And honestly, we need someone who understands trauma care from multiple angles, not just the surgical component. Walsh added, "We'd be pairing you with a new chief trauma surgeon, someone collaborative who values team input. You'd work together but maintain independent authority over your domains." Sarah's mind was racing. This was more than she'd expected. More visibility, more responsibility, more of everything she'd been avoiding. "What if I say no?" she asked. "Then we'll respect your decision and hope you'll stay on in your current role," Walsh said. "But we'll have missed an opportunity to fundamentally improve how this hospital handles trauma. And I think you know we need that improvement." Rodriguez spoke up for the first time. "Sarah, I've reviewed incident reports going back 2 years. The cases where you raised concerns but were overruled, 3 of them resulted in poor patient outcomes that could have been prevented. Your clinical judgment has been consistently sound. We should have been listening all along." The words should have felt vindicating. Instead, they just felt sad. 3 patients who'd suffered because hospital hierarchy valued physician authority over nursing expertise. "Can I think about it?" Sarah asked. "Of course," Brennan said. "Take a week. We're not trying to pressure you. We're trying to make this right." Sarah left the meeting feeling disconnected from reality. 48 hours ago, she'd been the invisible nurse everyone mocked. Now she was being offered a director position with real authority. The whiplash was disorienting. Her phone rang as she reached the parking lot. "Morrison." "How's Ghost?" he asked without preamble. "Stable. They're prepping him for transport to Walter Reed this afternoon." "Good. I'm at the airport. Had to get back to base, but wanted to check in before I left." Morrison paused. "You staying at Ridgewood?" "They offered me a director position." "And?" "And I don't know. It's a lot of responsibility, a lot of visibility. Everything I came here to avoid." Morrison was quiet for a moment. "You know what Ghost said to me yesterday when he was lucid enough to talk?" "What?" "He said the ghost angel saved him twice now. First time in Kandahar, second time here. Said both times you appeared when he'd given up, when he thought it was over, and you just refused to let him die." Morrison's voice softened. "That's who you are, Sarah. You show up when things are desperate and you fight. Taking this position means you get to do that for more people, not just the ones who randomly end up in your ER. Or it means I become an administrator who spends all day in meetings and loses touch with actual patient care. Only if you let it. You've never let bureaucracy stop you before. Don't start now." After Morrison hung up, Sarah sat in her car watching hospital staff come and go. Young residents with their confident strides. Experienced nurses moving with efficient purpose. Security guards making rounds. The whole ecosystem of a hospital functioning around the constant reality of human fragility. She thought about the 3 patients whose outcomes could have been better if someone had listened to her concerns. About Ghost fighting the ventilator because nobody understood combat trauma psychology. About all the future patients who'd come through these doors needing expertise that most civilian hospitals couldn't provide. Her phone buzzed again. A text from Rivera. "Ghost's awake and asking for you." Sarah headed back inside, taking the elevator to the ICU. Ghost was still intubated, but his eyes were open and tracking. The sedation was light enough that he could communicate with head movements and hand squeezes. Sarah approached his bedside. "Hey, heard you were looking for me." Ghost's eyes found hers. He tried to speak around the endotracheal tube, making frustrated sounds. "Don't talk. Save your energy." Sarah pulled up a chair. "You're being transferred to Walter Reed this afternoon. They'll take good care of you there." Ghost shook his head slightly, his hand reaching out to grab her wrist. His grip was weak but insistent. "What is it?" Sarah asked. He couldn't answer with words, but his eyes were intense, trying to communicate something urgent. Sarah looked at the monitors. Everything was stable, no medical crisis. So what was he trying to tell her? Rivera appeared in the doorway. "He's been agitated since he woke up. Won't settle." Sarah turned back to Ghost. "Is something wrong? Are you in pain?" Ghost shook his head. He pointed at Sarah, then at himself, then made a gesture she couldn't interpret. "I don't understand," Sarah said gently. Ghost's frustration was visible. He grabbed the pen from Sarah's pocket and the small notepad she kept in her scrub shirt. His handwriting was shaky from the medications, but legible. "Stay." Sarah looked at the word. "Stay with you? I'll be here until they transfer you." Ghost shook his head emphatically. He wrote again, "Stay here, hospital, don't leave." Understanding dawned. Somehow Ghost had heard about the job offer, about the possibility she might quit, about the complicated situation with Marcus and the investigation. Hospital gossip traveled through walls, apparently. "That's not your decision to make," Sarah said quietly. Ghost wrote, "You save people. Stay. I can save people anywhere." More writing, words cramped and desperate. "Here needs you. I needed you. Stay." Sarah felt her throat tighten. This man had been dying twice in 2 days, and his concern was whether she'd keep working at the hospital that had treated her like garbage for 8 months. "Why does it matter to you?" she asked. Ghost wrote 3 words with shaking hands. "You don't hide." The words hit like a physical blow. Sarah stared at them while Ghost watched her with eyes that had seen combat and survival and the thin line between them. "Ghost Angel doesn't hide," Ghost wrote underneath. "Appears, fights, saves." Rivera stepped closer, reading over Sarah's shoulder. "He's right. That's who you are." Sarah looked between them, the operator she'd saved last night and the sergeant she'd saved years ago, both here because she'd refused to let them die when circumstances said they should. "The offer they made you," Rivera said quietly, "is it a good one?" "It's a director position, real authority to change protocols and training." "Then take it. Not for them. For the next guy like Ghost who needs someone who actually knows what they're doing." Ghost nodded emphatically, then winced at the movement. "Rest," Sarah commanded. You're going to pull something." But Ghost was already writing again. "Promise." Sarah stared at the word. A promise from Ghost Angel. The call sign she'd carried through 3 tours, through firefights and evacuations, and moments where the only thing between a soldier and death was her refusal to give up. That version of herself had never hidden, had never made herself small or invisible or dismissible. Maybe it was time to stop hiding. "I'll think about it," Sarah said, which wasn't a promise, but also wasn't a no. Ghost looked dissatisfied but too exhausted to argue further. His eyes drifted closed, the medications pulling him back toward sleep. Sarah stayed with him until the Walter Reed transport team arrived 3 hours later. They were efficient and professional, treating Ghost with the care reserved for wounded warriors. Colonel Morrison had apparently made calls because the team lead knew exactly who Sarah was. "Ma'am," the team lead said, extending his hand. "Captain Andrews, Colonel Morrison briefed us on your care. We'll take good care of him from here. His right chest tube needs monitoring. There was an occlusion issue that required replacement. Make sure the accepting facility knows." Already in the transfer notes. "Anything else?" Sarah looked at Ghost, sedated for transport but stable. "He's a fighter. Don't underestimate his pain tolerance. He'll hide how bad he's hurting." "Understood." They wheeled Ghost out, the operators forming a protective detail around the stretcher. Rivera stopped to shake Sarah's hand. "Whatever you decide," he said, "know that you made a difference. To Ghost. To me. To all of us." Then they were gone, leaving Sarah standing in an empty ICU room that smelled of antiseptic and old blood. She walked through the hospital aimlessly, not ready to go home, but not sure where else to be. Eventually, she found herself in the trauma bay, where everything had started 2 nights ago. Someone had restocked it, all the supplies she'd meticulously organized now perfectly arranged again. On the supply cart was a note written in Patricia's handwriting. "Sarah, thank you for showing us what real trauma care looks like." The night shift. Sarah stared at the note for a long time. Her phone buzzed, a text from an unknown number. "This is Marcus. I know you probably don't want to hear from me, but I wanted you to know that getting fired was the right call. I've spent the last day thinking about who I became, and I'm ashamed. You deserved better. Everyone did. I hope you stay at Ridgewood and make it the kind of place it should have been all along." Sarah didn't respond. Some things didn't need a response. She was heading toward the exit when she heard raised voices from the administrative wing. Curious despite herself, Sarah moved closer. Through the glass wall of a conference room, she could see Director Walsh, Helen Rodriguez, and several people in expensive suits. One of them was shouting about liability and settlements. Another was arguing about publicity. Walsh sat at the head of the table, looking exhausted. Rodriguez noticed Sarah watching and stepped out of the conference room, closing the door behind her. "This isn't about you," Rodriguez said quickly. Well, not directly. What's going on? Rodriguez hesitated. 3 former employees came forward this morning. They claimed they experienced similar treatment from Dr. Hale and filed complaints that were ignored. They're threatening legal action against the hospital for fostering a hostile environment. Sarah felt cold spread through her chest. They're suing? They're considering it. Walsh is trying to negotiate a settlement. Rodriguez looked back through the glass at the tense meeting. Your case brought theirs to light. They'd been silent, but seeing someone finally face consequences made them willing to speak up. So this is my fault? No, this is Marcus Hale's fault and the hospital's fault for not addressing his behavior sooner. You didn't create this problem. You just exposed it. Rodriguez met Sarah's eyes. And the board is taking it seriously specifically because they don't want it to happen again. That director position they offered you? It's partly strategic. They need to show they're committed to change. Sarah should have expected that. Of course, there were ulterior motives. Of course, it wasn't just about her expertise. Does that change the offer? Rodriguez asked. Knowing the hospital politics behind it? Sarah thought about that. Did it matter why they were offering the position if the end result was better trauma care? Did it matter if their motivations were partly about avoiding lawsuits, if she could still save lives? I don't know, Sarah said honestly. She left before Rodriguez could push further. Outside, the evening air was cool and clean after yesterday's storm. Sarah sat on a bench near the emergency entrance and watched ambulances come and go, each one carrying someone's crisis, someone's worst day. Her phone rang, an unfamiliar number with a Virginia area code. This is Sarah. Lieutenant Bennett, this is General Patricia Kearns, Walter Reed National Military Medical Center. The voice was crisp and authoritative. I wanted to personally thank you for the care you provided to our operator. His condition has stabilized during transport, and our surgeons are optimistic about his recovery. That's good to hear, General. Colonel Morrison has briefed me on your situation. He also mentioned you're considering a position that would allow you to improve civilian trauma protocols. A pause. I wanted to offer an alternative perspective. We have openings for experienced trauma nurses at Walter Reed. Your combat experience and clinical expertise would be invaluable, and you'd be working with patients who understand exactly who you are and what you've done. Sarah hadn't expected a recruitment call from Walter Reed. I'm honored, but you don't have to decide now. Just know the option exists. Sometimes the best way forward is returning to where you're fully understood. Kearns softened slightly. The civilian world doesn't always know what to do with warriors, Lieutenant, but we do. After the call ended, Sarah sat in silence, watching the sky darken. 3 options now. Stay at Ridgewood as a staff nurse and remain invisible. Accept the director position and build something new despite complicated politics, or return to military medicine where her background wasn't something to hide or explain. None of them felt simple. None of them felt obviously right. Sarah was still sitting there when the emergency doors burst open and paramedics rushed in with a stretcher. She caught fragments of their report: multi-vehicle collision, critical injuries, massive trauma. The kind of case that required every available hand. Instinct moved her before conscious thought. Sarah stood and followed them into the trauma bay, where organized chaos had already erupted. Dr. Winters was there, calling out orders while residents scrambled. They were short-staffed. 2 nurses had called out sick, and the trauma bay was understaffed. Winters saw Sarah, and relief flooded her expression. Please tell me you're available. Sarah looked at the patient, a young woman, maybe 25, bleeding heavily from multiple injuries. The monitors showed pressure dropping fast. This was the kind of case where seconds mattered. I'm here, Sarah said. She scrubbed in and moved to the trauma bay, falling into the rhythm of emergency care like coming home. Her hands knew what to do. Her mind processed information with practiced efficiency. When Winters needed equipment, Sarah had it ready. When vital signs started dropping, Sarah was already adjusting interventions. They worked for 90 minutes straight, fighting to stabilize injuries that threatened to kill the patient a dozen different ways. It was brutal, exhausting work that demanded every bit of skill and experience Sarah possessed, but the patient survived. When they finally wheeled her to the OR for definitive surgical repair, Winters pulled off her gloves and looked at Sarah with exhaustion and respect. That woman is alive because you were here, Winters said simply. Sarah started to deflect, to minimize, to hide behind professional distance. Then she stopped. Because it was true. Her expertise had made the difference. Her training, her experience, her refusal to give up when the monitors were screaming bad news. It had saved a life. And that was why Ghost had written, "Don't hide," with shaking hands. Sarah looked at Winters. "The director position Walsh offered me. Is it real? Not just politics and liability management, but actually real?" "It's real," Winters said without hesitation. "Walsh wants to rebuild this trauma department into something worth bragging about. You could do that. You could make this place what it should be. Even though I'm a nurse, not a physician, especially because you're a nurse, you see the whole system. You understand what happens before the surgeon shows up and after they leave. You know how to build teams and protocols and cultures that keep people alive." Winters smiled tiredly. "Plus, you're not afraid to tell surgeons when they're wrong. That's valuable." Sarah felt something settle in her chest. Not certainty exactly, but clarity. She walked back to Walsh's office even though it was nearly 9 p.m. The lights were still on. Walsh apparently worked late. Sarah knocked. "Come in." Walsh looked up from her computer, surprise evident. "Sarah, I didn't expect to see you tonight." "I have an answer," Sarah said, "about the director position." Walsh stood slowly. "I told you to take a week." "I don't need a week." Sarah stepped fully into the office and closed the door behind her. "I'll take the position, but I have conditions." Walsh's eyebrows rose. "I'm listening." "Full authority over trauma protocols, not subject to approval by surgery or emergency medicine. If I say something needs to change, it changes." "Done." "Direct reporting line to you, not through a department head who can water down my recommendations." "Agreed." "And I want to build a combat trauma training program. Bring in veterans, teach civilian staff how to handle mass casualty events and penetrating trauma. Make Ridgewood Memorial a center of excellence for trauma care." Walsh was nodding before Sarah finished. "That's exactly the kind of initiative we need. What else?" Sarah took a breath. "I want Marcus Hale's termination to include a reference to the specific behaviors that led to it, not vague language about cultural fit or performance issues. If he tries to get another position somewhere, they should know what happened." "That's legally complicated," Walsh said carefully. "Then make it uncomplicated. He created a hostile environment that harmed staff and potentially endangered patients. The next hospital deserves to know that." Walsh considered this for a long moment. "I'll talk to legal. No promises, but I'll try. That's all I'm asking." Walsh extended her hand. "Welcome to leadership, Director Bennett." Sarah shook her hand and something fundamental shifted in her understanding of herself. She wasn't hiding anymore, wasn't making herself small or invisible or easy to dismiss. She was Ghost Angel, and Ghost Angel didn't back down from fights that mattered. Sarah left Walsh's office feeling lighter than she had in months. The decision was made. The path was chosen. Whatever came next, she'd face it as herself, fully, completely, without apology. She was walking toward the exit when she heard a commotion from the emergency entrance. Shouting, multiple voices raised in anger. Sarah turned to see what was happening and stopped cold. Marcus Hale stood in the waiting room, disheveled and wild-eyed, arguing with security. He was drunk. Sarah could see it in his movements, hear it in his slurred words. "I need to talk to Director Walsh," Marcus was saying loudly. "I need to explain. This is all a misunderstanding. I built this trauma department. I made it what it is. You can't just throw me out." Security was trying to calm him down, guide him toward the exit. Marcus wasn't complying. Then his eyes found Sarah across the waiting room. Everything stopped. Marcus stared at her with an expression that cycled through recognition, rage, desperation, and something darker. "You," he said, his voice carrying across the space. "This is all because of you." Sarah stood frozen as Marcus lurched toward her, security guards scrambling to intercept him. "You destroyed everything," Marcus shouted, pointing at Sarah with shaking hands. "My career, my reputation, everything. And for what? To prove you're special? To show everyone you're some kind of hero?" Security grabbed his arms, but Marcus kept talking, his words tumbling out in an alcohol-fueled stream. "You think taking my job makes you better than me? You're still just a nurse, still just someone who follows orders. You'll never be what I was." Sarah found her voice. "I'll never be someone who tormented their staff and endangered patients." "You're right about that." Marcus tried to lunge forward. Security held him back. "I'm calling the police," one of the guards said into his radio, but Marcus wasn't done. "You want to know the real reason I hated you? Because you made me feel small. Every time you quietly did your job, every time you were right about something, every time you showed competence I couldn't undermine, you made me feel insignificant, so I had to make you smaller to feel big again." The confession hung in the air, raw and honest in its ugliness. "And now," Marcus continued, his voice breaking, "I have nothing. No job, no respect, no future. While you get promoted and celebrated. How is that fair?" "It's not about fair," Sarah said quietly. "It's about consequences." Police arrived then, taking custody of Marcus from security. He went without resistance, the fight draining out of him as quickly as it had appeared. As they led him away, he looked back at Sarah one last time. "I'm sorry," he said, and for the first time it sounded genuine instead of strategic. "I'm sorry for all of it." Then he was gone, escorted out into the night. Sarah stood in the waiting room surrounded by shocked witnesses. Someone touched her arm, Patricia, the charge nurse. "Are you okay?" Patricia asked. Sarah realized she was shaking. Not from fear. From the release of 8 months of accumulated tension. From watching the man who'd made her life miserable finally, completely, undeniably face the consequences of his choices. "I'm fine," Sarah said. And she meant it. But as she walked to her car, her phone buzzed with a text from an unknown number. She opened it and felt ice flood her veins. The message was simple. "You shouldn't have taken that job. Some people don't forget. Some people don't forgive." The number was blocked. The sender, anonymous. Sarah looked around the parking lot, suddenly aware of shadows and empty spaces. Someone was watching. Someone was angry. And whoever they were, they knew exactly where to find her. Sarah screenshot the message and forwarded it to hospital security before she even left the parking lot. Her hands were steady on the phone, but her pulse hammered in her ears. The lot was well lit, but suddenly every shadow felt like a threat. She scanned the rows of cars, looking for movement, for anyone watching. Nothing obvious. But that didn't mean they weren't there. She drove home, checking her rearview mirror every 30 seconds. No one followed. Her apartment building looked normal. Same flickering light over the entrance. Same scatter of residents' cars in assigned spots. Sarah parked and sat for a moment, engine off, listening to the cooling tick of metal. The text could be from anyone. A friend of Marcus's, another staff member who resented her promotion, some random person who'd heard the story and decided to play vigilante. Without knowing who sent it, she couldn't assess the actual threat level. Sarah went inside, locked her door, checked her windows. Everything secure. She forwarded the screenshot to Morrison too, then to Helen Rodriguez with a brief explanation. Cover all bases. Document everything. Old military habits reasserting themselves. Her phone rang immediately. Morrison. "Tell me you're somewhere safe," he said without greeting. "I'm home. Door's locked." "That text is a direct threat. You need to take it seriously." "I'm taking it seriously. I've already notified hospital security and HR." "That's not enough." Morrison's voice had the clipped quality he got when making tactical decisions. "I'm calling Silver Ridge PD, getting you a case number, and I want you to consider staying somewhere else tonight. I'm not running from some anonymous coward with a phone." "Sarah, you just cost someone their career and exposed a pattern of abuse. People do stupid things when they're cornered and angry." Sarah wanted to argue, but Morrison had a point. Marcus had shown up drunk and confrontational at the hospital. If he'd sent that text, or told someone else to send it, he was already beyond rational decision-making. "I'll stay alert," Sarah said, "but I'm not leaving my home." Morrison sighed. "At least tell me you still know how to handle yourself if things get physical. Muscle memory doesn't forget." "Good. Keep your phone on. I mean it. All night. Volume up, next to the bed." After Morrison hung up, Sarah did a thorough apartment check. Windows locked. Door chain engaged. Kitchen knives accounted for and secured. She changed into comfortable clothes that she could move in if needed. Old habits from deployments where you slept in boots because mortar attacks didn't wait for you to get dressed. Sleep came in fragments. Sarah woke every hour listening to apartment sounds. Footsteps in the hallway that were just neighbors. Car doors that were just people coming home late. At 4 a.m., she gave up and made coffee, watching the sunrise through her kitchen window while her mind ran through scenarios. The morning news was playing on her laptop when her phone buzzed. Helen Rodriguez. Can you come in early? We need to talk before your shift. Security matter. 7 a.m., my office. Sarah showered, dressed, and drove to Ridgewood Memorial through empty morning streets. The hospital was quiet at this hour. Shift change hadn't happened yet, just the skeleton overnight crew winding down. Rodriguez's office was on the administrative floor. She was already there when Sarah arrived, along with two people Sarah didn't recognize, a man in a suit and a woman in a police uniform. Sarah, this is Detective Frank Cordero and Officer Janet Mills from Silver Ridge PD, Rodriguez said. They're here about the threat you received. Detective Cordero was maybe 50, with the weathered look of someone who'd seen enough stupidity to last several lifetimes. He gestured for Sarah to sit. Ms. Bennett, we've reviewed the message you forwarded to hospital security. Have you received any other communications from this number? No, just that one text. Any idea who might have sent it? Sarah hesitated. Dr. Marcus Hale was here last night. He was intoxicated and angry about being terminated. Security and police removed him. The timing suggests he might be involved. We're aware of that incident, Officer Mills said, consulting her notes. Dr. Hale was arrested for public intoxication and disturbing the peace. He posted bail at 2 a.m. 2 a.m., Sarah repeated. The text came at 9:45 p.m. So either he sent it before being arrested or someone else sent it, Cordero said. We're trying to trace the number, but it's a burner phone, bought with cash, no registration. Whoever sent this knew how to cover their tracks. Rodriguez leaned forward. Sarah, hospital security reviewed camera footage from last night. We found something concerning. She turned her laptop screen to face Sarah. The video showed the parking lot from multiple angles, timestamp reading 9:30 p.m. Sarah watched herself walk to her car, get in, sit for a moment. Then the camera angle shifted to show a figure standing near the far edge of the lot, partially obscured by a utility van. The figure was watching Sarah's car. When Sarah pulled out, the figure moved deeper into shadows. We can't get a clear visual on their face, Rodriguez said, but someone was definitely watching you. Sarah felt cold spread through her chest. Can you track where they went? They left the parking lot on foot, heading toward the residential area north of the hospital. We lose them after that. Cordero closed his notebook. Ms. Bennett, I'm going to be direct. This looks like premeditated stalking behavior. Someone positioned themselves to watch you, sent a threatening message while observing your reaction, then disappeared. That's not impulsive anger. That's calculated intimidation. What do we do about it? Sarah asked. We file a formal report. We investigate. We increase security presence at the hospital and recommend you take precautions at home. Cordero's expression softened slightly. But without knowing who sent it, our options are limited. If you receive any other communications, contact us immediately. Don't respond, don't engage. The meeting ended with Sarah feeling more unsettled than before. She went to the locker room to change into scrubs, her mind spinning through possibilities. Who hated her enough to do this? Marcus was the obvious answer, but something about that felt too simple. The text had come while he was already at the hospital causing a scene. Why would he send a threat when he was about to confront her directly? Unless it wasn't Marcus at all. Sarah's first shift as Director of Trauma Services didn't officially start until the following week, but Patricia had asked her to come in for a meeting with the trauma staff. Apparently, word of her promotion had spread, and people had questions. The conference room was packed when Sarah arrived. Nurses, residents, physicians, respiratory therapists, easily 30 people crammed into a space meant for 20. The conversations died when she entered. Patricia stood. Everyone, this is Sarah Bennett. As you probably heard, she's been named our new Director of Trauma Services. She's agreed to answer questions this morning before the official transition next week. Silence. No one wanted to ask the first question. Finally, a young nurse Sarah recognized from day shift spoke up. Is it true you served in combat zones? Yes, 3 tours with the 75th Ranger Regiment as a trauma specialist. And you never mentioned it because it wasn't relevant to doing my job here. Or so I thought. Sarah scanned the room. I came to Ridgewood to be a nurse, not to trade on my military service. I wanted to be evaluated on my current work, not my past credentials. A resident raised his hand. But you were being evaluated. Dr. Hale constantly criticized your methods. He did. Why didn't you defend yourself? Why didn't you tell him about your background? Sarah considered the question. Because defending yourself to someone who's already decided you're worthless doesn't work. They'll just find new reasons to dismiss you. I chose to let my work speak for itself. But it didn't speak loud enough, the resident pressed. We all dismissed you too. We laughed when Dr. Hale mocked you. The room went uncomfortable. Several people looked at the floor. Yeah, Sarah said quietly. You did. Dr. Winters, standing near the back, spoke up. I think what people want to know is how we move forward from here. How we become the kind of department that doesn't make the mistakes we made. Sarah appreciated the redirect. That's exactly what I want to address. The trauma department needs systematic changes, protocol updates, training programs, culture shifts. I'll be implementing those over the coming months. But the biggest change needs to be how we value expertise regardless of where it comes from. Nurses see things doctors miss. Technicians notice things physicians overlook. If we create an environment where only certain people's observations matter, we'll keep missing critical information. What if people disagree with your protocols? Someone asked. Then they make their case with evidence and we discuss it. I'm not interested in ruling by authority. I'm interested in building systems that keep patients alive. Sarah paused. But I will overrule decisions that I believe are dangerous, and I won't apologize for that. A physician Sarah didn't recognize spoke from the side of the room. What happens to people who worked closely with Dr. Hale? Are we all under suspicion now? You're under evaluation. Everyone is. I'll be reviewing case outcomes, incident reports, and staff feedback. If you participated in creating a hostile environment, there will be consequences. If you enable dangerous practices, we'll address that. But I'm not interested in witch hunts. I'm interested in improvement. The questions continued for another 30 minutes. Some hostile, some genuinely curious, most somewhere in between. Sarah answered them all with the same calm directness. She wasn't trying to make friends. She was trying to establish credibility. When the meeting ended, people filed out in clusters, conversations resuming in hushed tones. Dr. Winters lingered. That went better than I expected, Winters said. The bar was pretty low. True, but you handled it well. Firm without being vindictive. That's the right tone. Winters hesitated. Helen told me about the threat you received. Are you okay? I'm managing. That's not what I asked. Sarah looked at Winters, one of the few people who'd treated her decently from the start, who'd never bought into Marcus's narrative about her incompetence. I'm unsettled, Sarah admitted. Someone's watching me. Someone's angry enough to make threats. And I don't know who or why beyond the obvious. The obvious being Marcus. Maybe. But it could be anyone who benefited from the old system. Anyone who resents the changes coming. Anyone who thinks I don't deserve this position. Sarah shook her head. That's a lot of potential suspects. Hospital security is taking it seriously? They are. Police too. But without knowing who sent the message, there's not much they can do except increase patrols. Winters frowned. Watch your back. People who feel entitled to power don't give it up easily. Sarah went to the cafeteria for coffee and found Melissa sitting alone at a corner table. The young nurse looked up when Sarah approached, her expression uncertain. Can I sit? Sarah asked. It's your hospital now. It's not my hospital. I just work here. Sarah sat anyway. You've been avoiding me. Melissa stared at her coffee. I said terrible things about you. I laughed when Dr. Hale mocked you. I told you to stop acting like you knew better than everyone else when you actually did know better. Her voice cracked. How am I supposed to look at you now? By understanding that you made mistakes and choosing to do better going forward. That's it? That's all you have to say? What do you want me to say, Melissa? That you're a terrible person? That you should quit? Sarah leaned back. You're young. You followed the lead of someone in authority because that felt safe. That's human nature. But now you know better, so do better. Melissa wiped her eyes. I want to transfer to a different department. I can't work in trauma anymore knowing what I did. That's running away. That's removing myself from a situation where I caused harm. Or it's taking the easy way out instead of facing the discomfort of having to prove you've changed. Sarah's voice softened. Stay. Work harder. Treat people better. Show me and everyone else that you learned something. That's worth more than running. Melissa was quiet for a long moment. You're giving me a second chance even after everything? I'm giving you the opportunity to earn a second chance. There's a difference. Sarah's phone buzzed. A text from Detective Cordero. Need you to come to the station. We have information about your case. Sarah drove to the Silver Ridge Police Department immediately. Cordero met her in the lobby and led her to a small interview room that smelled like stale coffee and old paperwork. We traced the burner phone's purchase, Cordero said, pulling out a file. Bought 3 days ago at a convenience store on Route 14. We pulled security footage. He turned a laptop towards Sarah. The footage showed a person in a hoodie and sunglasses purchasing a prepaid phone with cash. The cashier barely looked up during the transaction. Can you identify them? Cordero asked. Sarah studied the footage. The person's build, the way they moved, something about their posture. She played the video again, focusing on their hands as they counted out bills. That's not Marcus, Sarah said slowly. He's taller and moves differently. You're sure? Yes. This person is shorter, stockier, different gait entirely. Cordero made a note. So we're looking at an accomplice or a completely different suspect. What about the person in the parking lot footage? Can you compare body types? We tried. The parking lot angle isn't clear enough for definitive comparison, but they could be the same person. Cordero leaned forward. Ms. Bennett, I need you to think carefully. Is there anyone else who might have reason to threaten you? Someone whose career or reputation was damaged by the investigation into Dr. Hale? Sarah's mind went through the possibilities. Residents who'd aligned themselves with Marcus and now looked complicit. Nurses who'd participated in the hostile environment. Administrators who'd ignored complaints and were now under scrutiny. There are several people who might resent me, Sarah said, but I can't think of anyone who'd escalate to stalking and threats. People surprise you when they're cornered. Think about it. Anyone who's acted strangely around you recently? Anyone who seemed particularly angry about the changes? Before Sarah could answer, Cordero's phone rang. He answered, listened, his expression hardening. We'll be right there, he said, hanging up. He looked at Sarah. There's been an incident at the hospital. Someone vandalized your car. They drove back to Ridgewood Memorial with lights flashing. Sarah's Honda was in the staff parking lot, exactly where she'd left it, except now the windshield was shattered and all 4 tires were slashed, spray painted across the hood in red letters, "Quit or else." Hospital security had cordoned off the area. Officer Mills was already there, taking photos. Sarah stared at her destroyed car, feeling something cold and hard settle in her chest. This wasn't just intimidation anymore. This was escalation. This was someone willing to commit criminal acts in broad daylight. When did this happen? Cordero asked Mills. Sometime in the last 2 hours. Security cameras in this section have been malfunctioning for the past week. Facilities was scheduled to repair them tomorrow. Convenient timing, Cordero muttered. Sarah looked around the parking lot. Dozens of cars, dozens of potential witnesses. Someone must have seen something. We're canvassing now, Mills said. But it's a weekday morning. Most people are inside working. Rodriguez appeared, looking shaken. Sarah, I'm so sorry. We're reviewing all security protocols. This shouldn't have happened on hospital property. Where was Marcus Hale this morning? Sarah asked Cordero. We're checking now. Cordero was already on his phone calling someone. Sarah walked around her car, examining the damage. The slashed tires were cut cleanly, probably a utility knife. The windshield was shattered from a single impact point, suggesting a heavy tool, maybe a hammer. The spray paint was still slightly wet. This was recent, Sarah said, within the last hour. Which means they might still be nearby, Cordero said. He radioed for additional patrol units to search the area. Sarah's phone buzzed. Another text from the blocked number. Last warning, leave while you still can. She showed it to Cordero immediately. They're watching you right now, Cordero said, scanning the parking lot. They knew you'd find the car. They wanted to see your reaction. Sarah felt exposed standing in the open lot. Whoever was doing this could be in any of the surrounding buildings, watching through windows. Could be in another car in the lot. Could be anywhere. Get inside, Cordero said. We'll handle the scene. Sarah wanted to argue but recognized good advice when she heard it. She went back into the hospital, Rodriguez accompanying her. You should go home for the day, Rodriguez said. This is too much. And go where? My car is destroyed, and going home just isolates me, makes me an easier target. Sarah shook her head. I'm staying here where there are witnesses and security. Then stay in the administrative wing. We'll have security posted outside whatever office you're using. Sarah spent the next 3 hours in a borrowed office, fielding calls from Morrison, Walsh, and eventually the hospital's legal team. Everyone wanted to know if she was safe, if she needed anything, if she wanted to reconsider the director position. That last question made something snap into clarity. "That's what they want," Sarah said to Walsh during their call. "Whoever's doing this wants me to quit. They're trying to scare me into walking away." "It's working," Walsh said bluntly. "I'm scared for you. This has escalated beyond workplace harassment into criminal territory, which means we're close to something, close to identifying who's behind it. People don't escalate like this unless they're desperate." Walsh was quiet for a moment. "Sarah, I need to ask you a difficult question. Is this position worth your safety?" Sarah thought about Ghost writing "Don't hide" with shaking hands, about Rivera saying the men she'd saved didn't forget, about the 3 patients whose outcomes could have been better if someone had listened to her concerns. "Yes," Sarah said, "it is." At 2 p.m., Detective Cordero returned with news. "We've located Dr. Hale. He was at his attorney's office all morning, 30 miles away. Multiple witnesses confirm his presence. He couldn't have vandalized your car." "So it's definitely someone else," Sarah said. "Or he hired someone to do it while he established an alibi," Cordero countered. "But we have no evidence of that. What we do have is this." He showed Sarah his phone, a still image from security footage, not from the parking lot, but from a camera near the hospital's loading dock that had captured someone walking quickly away from the direction of the parking lot. The timestamp matched the window when Sarah's car was vandalized. The person wore dark clothes and a baseball cap pulled low. But something about their build, their stride, the way they carried themselves. Sarah's breath caught. "I know that walk. Who is it?" Sarah enlarged the image, studying the person's posture, the slight forward lean, the quick, efficient movements. Where had she seen that before? Then it clicked. "Jason," Sarah said quietly. "That's Jason Wells, the resident." Cordero immediately radioed for units to locate Jason. Within minutes, they had him. He was in the residence lounge, apparently on a break between cases. Sarah watched through the one-way glass as Cordero interviewed Jason in an interrogation room. The young resident looked genuinely confused. "I don't know what you're talking about," Jason said. "I've been in the hospital all day. You can check my schedule." "We have footage of someone matching your description leaving the parking lot area around the time Ms. Bennett's car was vandalized." "Then it's someone else who looks like me. I didn't go anywhere near the parking lot." Cordero showed him the image. Jason studied it, and his expression changed. "That's not me," he said slowly, "but I think I know who it is." "Who?" Jason hesitated, clearly uncomfortable. "That might be Tyler Brennan. He's a surgical resident. We're the same height and build. People mix us up sometimes." "Tyler Brennan," Cordero repeated, writing the name down. "Why would Tyler Brennan vandalize Ms. Bennett's car?" "I don't know, but he's been really angry since Dr. Hale got fired. They were close. Hale was his mentor. Tyler's been talking about how unfair it is, how Bennett destroyed Hale's career over nothing." Sarah felt pieces clicking together. Tyler Brennan. She'd seen him around the hospital, but never worked directly with him. He was a surgical resident, not trauma, so their paths rarely crossed. "Where's Tyler now?" Cordero asked. "He's supposed to be in surgery, Dr. Winters' service, I think." Cordero immediately called for backup and headed toward the surgical wing. Sarah followed despite his protests. They found Tyler scrubbing out of an OR, still in surgical scrubs. He looked up when he saw the police and his face went pale. "Tyler Brennan," Cordero said, "we need you to come with us." "For what?" "Questioning regarding vandalism and harassment." Tyler's eyes found Sarah standing behind Cordero. Something shifted in his expression, fear giving way to anger. "You're really going to destroy everyone, aren't you?" Tyler said to Sarah. "Hale your own reputation, now me. You're a wrecking ball." "Mr. Brennan, you need to come with us," Cordero repeated. "I didn't do anything." "Then you have nothing to worry about. Let's talk at the station." Tyler looked like he was considering running. Then his shoulders slumped. "I want a lawyer." "That's your right. Let's go." As they led Tyler away in handcuffs, Sarah stood in the surgical wing hallway feeling strangely hollow. This was supposed to feel like justice, like vindication. Instead, it just felt sad. A young resident throwing away his career because he couldn't accept that his mentor had been wrong. Dr. Winters appeared at Sarah's elbow. Tyler did this? Looks like it. I had no idea he was this unstable. He's been a solid resident. Good hands, good judgment in the OR. Good judgment medically doesn't mean good judgment personally. Winters nodded slowly. What happens now? Police will investigate. Hospital will probably suspend him pending the outcome. And I'll keep looking over my shoulder until I know for sure he was working alone. Sarah's phone rang. Morrison. Tell me they got him, Morrison said. They got someone. Tyler Brennan, a surgical resident, close to Marcus, angry about the investigation. And you're sure he's the one? Sarah thought about that. The timing fit. The motive made sense. The physical description matched the security footage. But something nagged at her, some detail that didn't quite align. Pretty sure, Sarah said. They'll know more after questioning him. But as she walked back to the administrative wing, Sarah couldn't shake the feeling that they were missing something. Tyler had been angry at the meeting that morning, but not threatening. Had he really escalated to vandalism and stalking in a matter of hours? Or was there still someone else out there, watching and waiting for the right moment to strike? Sarah was reviewing security protocols in Walsh's office when her phone buzzed with a call from Detective Cordero. She answered immediately. Tyler Brennan didn't do it, Cordero said without preamble. Sarah's stomach dropped. What? His alibi is solid. He was in surgery during the time window when your car was vandalized. Scrub nurse, anesthesiologist, and attending surgeon all confirm he never left the OR. The timeline doesn't work. Then who did I see in that footage? Someone who looks like him, someone who knew you'd make that connection. Cordero's voice was grim. We're releasing him. But Sarah, this means whoever's targeting you is still out there, and they're smart enough to set up a false lead. After the call ended, Sarah sat in silence trying to process this. Someone had deliberately dressed like Tyler, moved like Tyler, positioned themselves to be caught on camera looking like Tyler. That level of calculation suggested planning, patience, a specific agenda beyond simple revenge. Her phone buzzed again. Another blocked number, but this time it was a call, not a text. Sarah's finger hovered over the answer button. Cordero had said not to engage, but maybe hearing their voice would give her something, an accent, a speech pattern, background noise. She answered and said nothing, heavy breathing on the other end. Then a voice, distorted by some kind of filter that made it impossible to identify gender or age. You think you've won. You think taking Hale's job makes you special. Sarah kept her voice steady. Who is this? Someone who knows what you really are. Not a hero, not Ghost Angel, just a broken soldier playing dress-up in a hospital. The words were designed to hurt, to provoke a reaction. Sarah refused to give them one. If you have something to say, say it. You destroyed everything Hale built. Years of work, gone because you needed to prove yourself. And for what? So you can pretend the war didn't break you. Sarah's grip tightened on the phone. The war didn't break me. And Hale destroyed himself. Keep telling yourself that while you watch your back every second. Keep wondering who's next. Keep waiting for the next message, the next threat, the next... Sarah hung up. Her hands were shaking now, not from fear but from anger. This person knew too much about her military service, about her injuries. This wasn't a random supporter of Marcus's. This was someone with access to information that shouldn't be public. She called Cordero back immediately and reported the call. He promised to try tracing it, but wasn't optimistic about success. Then Sarah sat back and forced herself to think logically instead of emotionally. Who knew about her combat service before the incident with Ghost? Who had access to her personnel file? Who would benefit from her leaving Ridgewood Memorial? The answer hit her like cold water. Sarah pulled up the hospital's administrative directory on Walsh's computer. She scrolled through names until she found it. Jennifer Hale, Human Resources Specialist. Marcus Hale's sister. Sarah's mind raced through the implications. Jennifer had been working in HR for 3 years. She'd have access to all employee files, including Sarah's. She'd know about the military service, the medical discharge, the injury that caused the limp. And she'd have every reason to blame Sarah for her brother's termination. But accessing employee files for personal reasons was a fireable offense. If Jennifer was the one behind this, she was risking her own career. Unless she didn't care anymore. Unless her brother's destruction had pushed her past rational decision-making. Sarah called Cordero with her theory. He listened quietly, then said he'd look into it. 10 minutes later, he called back. Jennifer Hale called in sick today. Hasn't been at work since yesterday afternoon, right around the time your car was vandalized. And get this, her brother Marcus listed her as an emergency contact. When we picked him up for the drunk and disorderly, she was the one who posted his bail. She's been coordinating with him. Looks that way. We're trying to locate her now. Stay inside the hospital until we do. Sarah ended the call and found Helen Rodriguez explaining the situation quickly. Rodriguez went pale. Jennifer has been acting strange the last few days. Withdrawn, angry. I thought she was just processing the situation with her brother. Rodriguez pulled up Jennifer's employee file. She's supposed to be on medical leave, but her badge was used to access the building this morning at 6 a.m. Before my car was vandalized, Sarah said. She must have come in early, done the damage, then left before the cameras were repaired. Rodriguez was already calling security. We need to deactivate her access immediately. But it was too late for that. Sarah's phone buzzed with another text from the blocked number. Look outside your window. Sarah moved to the window of Walsh's office, which overlooked the main entrance. Standing in the visitor parking lot, staring up at the building, was a woman in her 30s with dark hair and Marcus Hale's exact bone structure. Jennifer. She was holding something. Sarah squinted, trying to see what it was. Then Jennifer raised her hand and Sarah saw the glint of metal. She has a gun, Sarah said, her voice cutting through the office. Jennifer Hale is outside with a weapon. Rodriguez immediately triggered the hospital's lockdown protocol. Alarms began blaring. Automated announcements instructed everyone to shelter in place. Security rushed to seal entrances. Sarah watched Jennifer through the window. The woman wasn't moving toward the building. She was just standing there, gun visible at her side, staring up at the administrative wing. Cordero called. We've got units en route. Do not engage. Stay away from windows. But Sarah couldn't look away. Jennifer's face was twisted with rage and grief. The expression of someone who'd lost everything and decided to take others down with her. Sarah made a decision that Morrison would have called reckless, and she knew was necessary. She left Walsh's office and headed for the main entrance. Sarah, no! Rodriguez called after her. Sarah ignored her. She moved through the lockdown chaos. Staff herding patients into rooms, security taking positions, frightened faces everywhere. The main entrance was sealed with security guards stationed inside. Sarah approached the glass doors where Jennifer was visible outside. One of the guards grabbed Sarah's arm. Ma'am, you need to get back. She's here for me, Sarah said. Let me talk to her. Absolutely not. Police are handling this. Police are 5 minutes away. She's here now with a weapon and a hospital full of people. Let me try to de-escalate before this gets worse. The guard hesitated, then spoke into his radio. After a tense moment, he stepped aside. Stay behind the glass. Don't go outside. Sarah moved to the doors. Through the glass, she could see Jennifer clearly now. Their eyes met. Sarah picked up the courtesy phone near the entrance that connected to the outside speaker system. Jennifer, my name is Sarah Bennett. I think you're here because of me. Jennifer's voice came through the external speaker, shaking with emotion. You destroyed my brother. Your brother destroyed himself. I just stopped him from hurting more people. He was a good doctor. He saved lives. He built that trauma department from nothing. He was a good surgeon, Sarah corrected. But being good at surgery doesn't excuse creating a hostile environment, doesn't excuse putting his ego above patient safety. You don't know anything about him, Jennifer shouted. You don't know the pressure he was under, the expectations, the hours he worked trying to make this place better. Sarah could hear sirens in the distance now. Police were close, but she needed to keep Jennifer talking, keep her focused on anything except that gun. You're right. I don't know everything about him, but I know what he did to me and others. I know he mocked my clinical judgment in front of residents. I know he created a culture where nurses were afraid to speak up. I know a patient almost died because he was too arrogant to listen. So you took everything from him, his job, his reputation, his future. I took nothing. I just stopped hiding who I was and what I knew. The consequences were his to own. Jennifer raised the gun slightly, not pointing it at Sarah exactly, but not pointing it away either. Several security guards tensed. Don't do this, Sarah said, keeping her voice calm. Whatever you think you're accomplishing, it's not worth throwing your life away. My life is already over. I helped him. I sent those messages. I vandalized your car. When they arrest me, I lose everything anyway. Then don't make it worse. Put the gun down before someone gets hurt. Someone already got hurt. My brother is destroyed. You did that. No, he did that to himself over 8 months of bad choices. I was just the catalyst that made everyone finally look at what he'd been doing. Police cars were pulling into the parking lot now, lights flashing. Officers were taking positions behind vehicles. A negotiator was probably on the way. Sarah had minutes at most before the situation escalated beyond her control. Jennifer, listen to me. I know what it's like to lose everything, to have the life you knew ripped away. Sarah pressed her hand against the glass. I lost my military career, lost my identity as a soldier, lost the only thing I'd ever been good at. I came here to hide from that pain, to pretend I could be someone new. Then you understand, Jennifer said, her voice breaking. You understand what it feels like. I do. But you know what I learned? Hiding doesn't work. Pretending doesn't heal anything. And hurting other people definitely doesn't make the pain go away. So what am I supposed to do? Just accept that my brother is gone? You accept that he made choices and those choices had consequences. You grieve the brother you thought you knew. And then you decide who you want to be next. But you can't do any of that if you're in prison or dead. Jennifer was crying now, gun still in her hand but lowered slightly. I just wanted to scare you, make you leave. Give him back what you took. I can't give that back. No one can. It's gone. The question is what you do with the time you have left. Behind Jennifer, Sarah could see the SWAT team assembling, snipers finding positions. This was about to turn into a tactical situation, and tactical situations ended badly for people holding guns. Please, Sarah said, put the weapon down. Let this end without more damage. Jennifer looked at the gun in her hand like she was seeing it for the first time. Then she looked back at Sarah through the glass. He was my brother, Jennifer whispered. He's all I had. I know. But he wouldn't want you to destroy yourself for him. That was probably a lie. Sarah had no idea what Marcus would want, but it was the right thing to say because Jennifer's shoulders slumped. Slowly, carefully, she bent down and placed the gun on the pavement. Then she raised her hands and stepped away from the weapon. Police swarmed her immediately. Jennifer didn't resist. They cuffed her and led her to a patrol car while Sarah watched through the glass, her own hands shaking now that the adrenaline was crashing. Rodriguez appeared at her shoulder. That was either incredibly brave or incredibly stupid. Probably both, Sarah admitted. The lockdown lifted slowly. Police secured the scene. Hospital staff began the process of returning to normal operations. Sarah gave her statement to Cordero, who looked equal parts impressed and annoyed. You could have been shot, he said, but I wasn't, and now it's over. For now. Jennifer's going to face multiple charges. Marcus might face conspiracy charges if we can prove he was involved in planning this. But Sarah, you need to understand, some people won't forgive you for what happened. You'll always have detractors. I can live with that. Walsh called an emergency meeting that afternoon with senior leadership. Sarah sat in the conference room, surrounded by administrators and department heads, while Walsh explained everything that had happened, the threats, the vandalism, the confrontation with Jennifer. Under the circumstances, one of the board members said, we would understand if you wanted to reconsider the director position. This has been an extraordinary level of stress. Sarah looked around the table at their concerned faces, well-meaning people who still didn't quite get it. I'm not reconsidering, Sarah said firmly. Jennifer Hale targeted me because I exposed her brother's misconduct. That's not a reason to step down. That's a reason to keep going. Because if I quit now, it proves that intimidation works. That people can harass and threaten their way to controlling who gets authority in this hospital. I won't be part of setting that precedent. Walsh smiled slightly. I was hoping you'd say that. The meeting continued for another hour, covering security improvements and support resources and legal implications. Sarah participated where necessary, but mostly she was thinking about what came next. The real work of rebuilding a trauma department, the training program she wanted to implement, the culture changes that needed to happen. By the time she left the meeting, it was nearly 6 p.m. Sarah's destroyed car had been towed, and she needed a ride home. Morrison had already arranged a rental that was waiting in the lot, keys left with security. Sarah drove home through evening traffic, her mind still processing everything. The threats were over. Jennifer was in custody. Marcus was facing the consequences of his actions. Justice, such as it was, had been served. But Sarah felt strangely empty. She'd spent 8 months being invisible and the last week being hypervisible. Neither extreme felt sustainable. She needed to find a balance, being fully herself without being consumed by the drama of what had happened. Her phone rang as she pulled into her apartment parking lot. Morrison. "Heard you talk down an armed woman today," he said. "News travels fast." "I have sources. Are you all right?" "I think so. Still processing. Jennifer's in custody. Marcus is cooperating with police to avoid charges himself. It's over, Sarah." "Is it?" Sarah turned off the car but didn't get out. "Because it feels like this is just the beginning. I've got a whole department to rebuild, staff who don't trust me, systems to change, and everyone watching to see if I fail." "Then don't fail." "That's helpful advice, thanks." Morrison laughed. "You've never failed when it mattered. Combat zones, impossible medical situations, dying patients. You don't fail under pressure. This is just a different kind of pressure. It's administrative pressure, politics and bureaucracy and hurt feelings. That's not my strength." "Maybe it will be. You didn't think you'd be good at civilian nursing either, and look how that turned out." After the call ended, Sarah finally went inside her apartment. She showered, changed into comfortable clothes, made dinner she barely tasted. Exhaustion was setting in, the kind that came from sustained adrenaline followed by sudden peace. She was almost asleep when her phone buzzed one last time, a text from an unknown number, but this one didn't feel threatening. It was from Ghost, transferred to Walter Reed. "Angel, heard what happened. Glad you're safe. Also heard you took the director job. About damn time someone who knows what they're doing runs that place. Heal well. We're counting on you." Sarah stared at the message for a long time. "We're counting on you, not just Ghost, but all the future patients who'd come through Ridgewood Memorial's trauma department, all the soldiers who might end up there, all the nurses who needed to see that expertise mattered regardless of where it came from." She typed back, "Heal well yourself, and stop getting shot." The next morning, Sarah reported for her first official day as Director of Trauma Services. She arrived early, before most staff, and walked through the trauma bays with fresh eyes. This was her department now, her responsibility, her chance to build something that actually worked. Patricia found her in Trauma Bay 2, checking equipment. "You're here early. Couldn't sleep, too much to do. I heard what happened yesterday. With Jennifer." Patricia's expression was complicated. "That was brave. Also possibly insane. I've been called worse. She could have killed you. But she didn't, because underneath the anger and grief, she didn't really want to hurt anyone. She just wanted her brother back." Sarah closed the supply cabinet she'd been organizing. "I understood that. Doesn't excuse what she did, but I understood it." Patricia leaned against the door frame. "The staff is nervous. About working under you. About the changes coming. About whether you're going to clean house and fire everyone who laughed at Marcus's jokes." "I'm not firing everyone. I'm evaluating everyone. There's a difference." "That doesn't make people less nervous." "Good. Nervous means they're paying attention. Means they're thinking about their choices." Sarah met Patricia's eyes. "I need people who can handle accountability. If they can't, they're right to be nervous." Over the following weeks, Sarah implemented changes systematically. New protocols for trauma assessment. Mandatory training on recognizing combat-related PTSD in patients. Weekly case reviews where every team member, from residents to nurses to techs, could voice concerns without fear of dismissal. She brought in veteran medical professionals to teach civilian staff about battlefield medicine principles. Some people left, residents who couldn't handle the increased scrutiny, nurses who preferred the old hierarchy where their opinions didn't matter as much, but neither did their responsibility. Sarah didn't stop them. The people who stayed were stronger for it. Melissa stayed. She worked harder than anyone, showed up early, took on difficult cases, proved through action that she'd learned. Sarah watched her growth and eventually made her lead nurse on night shift, a position that came with real authority and the trust that implied. Jason stayed too, though he struggled more. He'd been so embedded in Marcus's world that unlearning those patterns was painful. But he tried. That counted for something. Dr. Winters became Sarah's closest ally in the physician ranks. Together, they rebuilt the trauma service into something collaborative instead of hierarchical. Surgeons consulted with nurses. Residents learned to value input from experienced staff regardless of credentials. The department started functioning like a team instead of a collection of competing egos. 3 months after Sarah took the director position, Walter Reed sent a delegation to study Ridgewood Memorial's trauma protocols. They'd heard about the innovative combat trauma training program and wanted to evaluate it for potential military implementation. Sarah led the tour personally, walking them through simulated mass casualty drills and demonstrations of the integrated team approach. At the end of the visit, the delegation leader, a colonel Sarah had served with years ago, pulled her aside. "This is impressive work, Lieutenant. You've built something special here." "Just doing what needs doing. It's more than that. You've taken civilian medicine and enhanced it with battlefield lessons most hospitals never learn. This could save lives far beyond Ridgewood Memorial." 2 weeks later, Walsh called Sarah into her office with news. 3 other hospitals in the state wanted to implement similar programs. They were asking if Sarah could consult on their development. "This could become a regional standard," Walsh said. "Combat-informed trauma care. You'd be pioneering a whole new approach." Sarah thought about that. About taking what she'd learned in the worst circumstances and using it to save lives in ordinary ones. About Ghost Angel not being a call sign from the past, but a mission for the future. "I'm interested," Sarah said, "but Ridgewood stays my priority. Wouldn't have it any other way." On a quiet Thursday evening, 6 months after everything started, Sarah was finishing paperwork when she heard a commotion in the ER. She headed down to investigate and found Rivera and 3 other operators carrying someone on a stretcher. For a sick moment, she thought it was Ghost again. But the patient was a different soldier, injured during a training accident. Rivera saw Sarah and his face showed relief. "We asked for the Angel," Rivera said simply. "They told us she runs this place now." Sarah assessed the patient quickly. Compound fracture, significant blood loss, stable but needing immediate intervention. She called for Dr. Winters and assembled her team. They worked together seamlessly, the kind of coordinated care that came from months of training and mutual respect. The soldier survived with full function preserved. Before Walter Reed's transport team arrived, he thanked Sarah personally. "Rivera told me about you," the soldier said. "Said if anyone could fix me up, it was Ghost Angel." Sarah smiled. "Ghost Angel's just a nurse with some extra training. You did the hard part by staying alive long enough to get here." After the soldier was transferred, Sarah returned to her office and found Morrison waiting in the hallway. She hadn't seen him since the incident with Jennifer, though they'd talked by phone regularly. "Colonel, what brings you to Colorado? Wanted to check on my favorite trauma director, see if civilian life is treating you well." They walked to the cafeteria and got terrible coffee. Morrison looked tired but pleased. "I heard about the consulting work," he said. "Training other hospitals in combat trauma protocols. That's good work, Sarah." "It's needed work. Too many civilian hospitals have no idea how to handle mass casualties or penetrating trauma. We can change that." "You sound like someone who's found their purpose." Sarah considered that. "Maybe. It's not combat medicine. It's not active duty, but it's using everything I learned to save lives. That counts for something." "It counts for a lot." Morrison took a sip of his coffee and grimaced. "How are you doing?" "Really?" "Better. The nightmares are less frequent. The limp bothers me less. I'm sleeping more than 4 hours a night." Sarah paused. "I'm not hiding anymore. That helps more than anything." "Ghost Angel doesn't hide." "No, she doesn't." Morrison left the next day, but his visit reminded Sarah of how far she'd come. From invisible nurse to director. From Ghost Angel, the battlefield legend, to Ghost Angel, the teacher. From hiding her expertise to using it to fundamentally change how hospitals approached trauma care. A year after taking the director position, Sarah stood in front of the Colorado Healthcare Association presenting her trauma protocols to an audience of hospital administrators and medical professionals. She talked about combat lessons, about team-based care, about creating environments where expertise was valued regardless of its source. When she finished, the applause was genuine. People came up afterward wanting to implement similar programs, wanting her guidance, wanting to learn from someone who'd earned credibility the hardest possible way. That night, Sarah returned to Ridgewood Memorial for the late shift. She still covered patient care regularly, refused to become an administrator, so removed from bedside medicine that she forgot what mattered. She was updating charts when a new nurse approached hesitantly. "Director Bennett, I just started here and I wanted to introduce myself. I'm Amanda. I heard about your program and specifically requested a transfer to Ridgewood." "Welcome. What brings you here?" "I'm a veteran too. Army medic, 2 tours. I've been struggling to find a place that understood what I could bring to civilian medicine. Then I heard about what you built here, and I thought maybe this is where I'm supposed to be." Sarah smiled, seeing herself in Amanda's cautious hope. "We're glad to have you. Experience like yours makes us better." "Really?" "Because most places I interviewed, they looked at my military background like it was a liability, like I'd be too rigid or aggressive or damaged. Not here. Here we understand that different experiences create different strengths. You bring things to this department that traditional training can't teach." Sarah gestured around the ER. "This is a place where people who've been invisible get to be seen, where expertise matters more than hierarchy, where being underestimated just makes your comeback better." Amanda's eyes were bright. "That's exactly what I needed to hear." Sarah introduced Amanda to the team, watched her integrate into the night shift rhythm, saw the recognition in other staff members' eyes that this new nurse brought something valuable. The culture she'd built was working. The changes were lasting. Later that night, Sarah stepped outside for air. The Colorado sky was clear and full of stars. She thought about Ghost recovering at Walter Reed, probably harassing his physical therapists. About Rivera and the other operators who trusted her enough to bring their wounded to Ridgewood. About the 3 patients whose outcomes could have been better if someone had listened to her concerns. And all the future patients whose outcomes would be better because now people did listen. She thought about Marcus Hale, who'd lost everything because he couldn't accept that competence existed outside his narrow definition. About Jennifer, serving time for choices made in grief and anger. About Tyler and Jason and Melissa and all the others who'd learned that dismissing people based on assumptions instead of evidence carried real costs. And she thought about Lieutenant Sarah Bennett, Ghost Angel, who'd spent years hiding from her own strength and was finally learning to carry it openly. Her phone buzzed. A text from an unknown number. For a brief moment, old fear flickered. Then she opened it. "Director Bennett, this is General Kearns from Walter Reed. We'd like to discuss having you keynote our trauma medicine conference next spring. Your work integrating combat protocols into civilian care deserves wider recognition. Let me know your thoughts." Sarah stared at the message. A year ago, she'd been the invisible nurse people mocked. Now military leadership wanted her to keynote conferences. The whiplash was still disorienting sometimes, but she'd earned this. Not through drama or conflict, but through competence. Through refusing to stay small when she had the skills to be large. Through showing up when people needed her and doing the work that mattered. Sarah typed back, "I'm honored. Let's make it happen." She went back inside where monitors beeped and patients needed care, and her team was saving lives using the protocols she'd built. This was Ghost Angel's mission now. Not appearing out of smoke and gunfire to rescue dying soldiers, but building systems that rescued everyone. The nurse they'd dismissed had become the director they needed. The woman they'd mocked had become the leader they followed. Not because she'd proven them wrong through some dramatic revelation, but because she'd simply refused to hide who she was and what she knew. And in refusing to hide, she'd shown everyone else what real strength looked like. Not loud or arrogant or aggressive, just steady, competent, and absolutely unwilling to compromise when lives were on the line. Sarah Bennett walked through her trauma department with her head high and her limp barely noticeable, fully visible at last, exactly where she was supposed to be. Ghost Angel didn't hide anymore. She built, she taught, she saved, and she'd never apologize for being exactly who she was meant to be.